Good morning, ladies and gentlemen. I'm Tomlin Paul, Dean of the Faculty of Medical Sciences here at the University of the West Indies, Mona, Jamaica. And it's my pleasure to welcome you to the third in our series of COVID-19 teleconferences. Now, if you attended the first two, you'd recall that we spent a lot of time looking at the epidemiology of COVID-19. We looked at the virology, looking at the virus. We looked at testing. We looked at issues to do with containment, mitigation, what's happening with our ministry and our government national efforts. Today we are focusing on children and families in the Caribbean. And our conference is being done collaboratively between the Faculty of Medical Sciences, between the faculty and the Mona Information Technology Services. Our UE Mona media team is here with us, and also our Marketing and Communications division here on the campus. The impact of COVID-19 on vulnerable groups has been a topic of discussion. And we have talked about the impact that this pandemic has had on older members of our population, seniors. We have talked about the impact on persons with pre-existing conditions. But on a wider analysis of the COVID-19 pandemic, what we're already seeing is that the concept of vulnerability extends far beyond these groups that we have alluded to. In a wider sense, in thinking about health, the impact of this pandemic touches the heart and soul of our community, families. And within families, we have children, we have parents, we have fathers, we have mothers. And it is very much a question of what is happening, not only at the clinical or the physical level, but what's happening within this family setting, within your family, my family, our families. So COVID-19 affects the social fabric of our communities. And today I'm pleased to have a range of excellent speakers who are going to share on a range of topics. We have speakers from the government, our Ministry of Education, from the World Bank, from UNICEF, our NGOs, and of course from our very own University of the West Indies. I'm very proud to be hosting this third conference with you. I want to say we are happy for the support of the university. Our Vice Chancellor, Sir Hilary Beckles, is a driver of this kind of outreach. The UE COVID-19 Task Force, chaired by PVC Landis, has been doing excellent work in reaching out and giving advice on the COVID-19. And so we continue today to share with you information and always a bit of hope that with the knowledge we give and the credible information, that we hope we can anchor and bring some stability to the fear and anxiety that is out there with respect to COVID-19. I want to say before we move into our first session, a special thanks to Professor Maureen Sams-Vaughan. This was the thought, this particular teleconference was her baby, if I may use no pun intended in terms of it being on children, but she very much said, hey, we got to do this one. We got to look at this picture of what's happening with our families and our children. You will hear from Professor Sams-Vaughan later on this morning. Now, remember that as you listen to the speakers and as you participate in this conference, please send us your questions. Just type it in the chat room, and we will be here to respond live with you to your questions. So don't be afraid. We want to hear from you. We thank you for coming, for tuning in, checking in with UE Mona Media. Tell your friends and families to join in this morning as we survey a range of topics relevant to children and family and COVID-19. Thank you for joining us, and welcome. So our first speaker this morning in our conference is one who has actually opened the batting in the first two conferences. And today again, I don't know if she plays cricket, but she's a good batsman, I would say, in the academic circles and in our professional circles. And this is not a very familiar face to you, Professor Celia Christie. Professor Christie is Professor of Pediatrics, Infectious Disease, Epidemiology, and Public Health within the Department of Child and Adolescent Health here at our University of the West Indies, Mona. She is no stranger to this topic. She's going to look at COVID-19 in children, but no stranger because in the years gone by, Professor Christie has been looking at things like rotavirus in children, Zika in children, chick V. So all of the emerging infectious diseases that we have seen over the years, our distinguished professor has researched and brought evidence and science and guidance to us. And today we are very pleased to have her here to share with us and to speak on COVID-19 in children. Let us welcome Professor Celia Christie.
Good morning, faculty, students, family. In fact, good morning, everyone. It is my pleasure, my privilege, and my honor to speak this morning on COVID-19 in children in this, the third UWI Faculty of Medical Sciences third conference series on COVID-19. I want to thank Professor Samsvon and the organizers for inviting me here today. So the novel SARS-CoV-2 causes COVID-19 and has been causing epidemic disease for some time now, such that the WHO declared a global pandemic on the 11th of March 2020, one day after Jamaica reported its first case. Globally, we have over 4.2 million cases and over 280,000 deaths reported around the world in the hospitalized patients primarily. The United States leads with about 1/3 of the cases and about 1/4 of the deaths. Infections occur wherever people cluster, regardless of temperature, whether it's from the icy cold Iceland to hot equatorial Guayaquil. We have now over 15,000 cases in the Caribbean and over 500 in Jamaica. The role of children and adolescents in this epidemic is evolving. First, we hear that the illness is rare or mild. However, in the last few weeks or so, and certainly in the last few days, we are hearing quite a bit about pediatric multisystemic inflammatory syndrome, which reminds us of Kawasaki's disease. And several children in Europe and in the United States are being admitted to ICUs because of this. There is also some new information coming forwards as it relates to disease transmission and children, and then I'll speak a little bit about outcomes. So the epidemic started in China in December of last year, and the majority of the earliest cases there were in men. Among 75,000 plus cases that were reported there through the WHO China joint mission through the 20th of February 2020, it was reported that 2.4% of them were children less than 18 years of age, and there were no deaths in those who were less than 9 years of age. There were no children reported in China during the period November 2019 through mid-January 2020. It is said that the children were indoors on spring holidays when the population exposures occurred, and the children stayed indoors as Wuhan went on lockdown. Later on, when children started to have the disease was reportedly mild, and they were identified primarily through contact tracing from adults. As we look at the worldwide prevalence, you will see here that in Spain, the prevalence is 0.8%. 41 of over 4,000 children were aged less than 18 years of age in Madrid. In Italy, the prevalence was 1.2%, and there were no deaths in children nor in adults younger than 30 years of age. In the United States, there were over 2,500 children for over 150,000 total cases for a prevalence of 1.7%, and there were 3 deaths reported out of that cohort. In Jamaica, the numbers that we have as of today, we have 505 persons reported in the island, and of these, 57 are children less than 18 years of age, for a prevalence of 11%. This is perhaps a little bit higher than the reports from other parts of the world, because the majority of these cases were contacts of a confirmed case that were identified through vigilant and vigorous contact tracing here in Jamaica. The majority of the children there in Jamaica are therefore asymptomatic. 13 of the children, or 23% of them, were hospitalized, and 6 of these were symptomatic. So far, we have 1 death This was a 4-year-old with COVID-19 pneumonia with a comorbidity of cerebral palsy. So we have been hearing all along that transmission is primarily through large droplets and associated mucous membrane contact and environmental aerosols in medical procedures. But recently, there is more attention being paid attention to the fact that this may well be airborne as well from small particle aerosols, which linger longer in the air and they travel further. There's also the issue of fecal-oral transmission with fecal aerosolization, which becomes important in flush toilets. Children and adults tend to have respiratory samples positive for 15 days, and sometimes even for longer, in weeks, in a paper that was just published this week. Feces, we know, tends to be positive for the virus for a much, much longer period, for a mean of up to 6 weeks, and this is especially so for children. Asymptomatic spread happens, and it happens in about 26% of cases, and in some cases they may say it goes up to 50 or even 80%. And pre-symptomatic transmission may occur even as early as 5 days before as well. Children are also thought to be silent spreaders, and sometimes they themselves may become infected in a household through familial household contact for 15% of the time, and as shown even here in Jamaica. A recent publication looked at the viral loads in adults and children for 3,700 population, and indeed they saw that the children were as infective as adults, and this was important for transmission and reopening of schools, because you see children and adults had the same viral load. In a big study that was just reported also in Science, contact surveys were done in China, and this showed that children were less susceptible to getting SARS-CoV-2 infection, and this was less than persons who were 15 to 64 years of age, and more so for persons who were older than 65 years of age. These persons were most susceptible. So the researchers concluded that social distancing alone may well be enough to control COVID-19, and then proactive school closures can help to reduce the peak incidence by as much as 40 to 60%, and thereby delay the epidemic. So we would ask, why do children get mild disease? Several theories have been posited. This includes the fact that the ACE2 receptors, which are the primary entry point for SARS-CoV-2, has less binding strength in children. Children also may have cross-protective immunity from the 4 common coronaviruses, which cause them to have respiratory tract infections and gastroenteritis quite frequently in early childhood. Children being less sick would therefore also be less likely to seek medical care and therefore be excluded from research and also from case series. So, looking at the clinical features in the first 2,000 children in China, it was noted that 34% of these were laboratory confirmed, 4% were asymptomatic, 50% were mild, 40% had moderate disease, and 5% had severe disease and had to be admitted to hospital. Critical cases occurred in 0.6%, and they had respiratory failure, shock, and multi-organ dysfunction, characterized by encephalopathy, cardiac failure, abnormal coagulation, and renal failure. In comparing the clinical features for children and adults in the United States, you will see that children and adults had the same findings as well. However, you'll see that children had these to a lesser extent than adults, so much so that you'll see that fever and cough only occurred half of the time in children as compared to adults. In addition, we still had myalgia, running nose, sore throat, headache, nausea, vomiting, abdominal pain, and diarrhea. Children in the United States were hospitalized 1% of the time. Looking at comorbidities in this population as well, you will see that 23% of these children had comorbidities. These included chronic lung disease, cardiovascular disease, and immunosuppression. For those who were hospitalized, 77% of them had a comorbidity, including all of the children who were admitted to an intensive care unit. For those who were managed as outpatients, 12% of them had comorbidities. Now, how do we manage these children? First, we have to recognize that very few of them are admitted to hospital. But wherever we see children, the parents are very concerned. We need to reassure them, and we need to involve them completely in their child's care. We need to be vigilant, extra vigilant in those with comorbidities. We do chest x-rays, bloods, and blood gases if there are complications like persistent fever, altered fluid balance, liver dysfunction, respiratory failure, or other signs of systemic involvement. Drugs may not necessarily be used routinely in children, and where ACE inhibitors or non-steroidal anti-inflammatory drugs are already being used for pre-existing conditions, we would say it is better to keep them on board. When there is fever, we would use paracetamol and use ibuprofen only with caution. Respiratory support, if required, is done according to our local guidance. Regarding drugs that are going to be efficient against SARS-CoV, some of the drugs that are being used are included here. Remdesivir has been shown in adults to reduce the viral shedding and recovery from 15 to 11 days in over 1,000 adults. However, we do not know how mortality was affected or adverse effects. Hydroxychloroquine is also being used, and as is lopinavir, ritonavir. But these drugs, we need to still have case control studies in very large quantities or very large numbers before we can make any firm conclusions about these two medications. Children have been receiving remdesivir and lopinavir, ritonavir, and this was shown in a study that was just published on the 11th of May. But again, we don't know how efficacious or effective these drugs are in children. And so the Solidarity trial, which is going on around the world, sponsored by the WHO, and which is also going on here in the Caribbean, with remdesivir, hydroxychloroquine, lopinavir, ritonavir, and also interferon. There is now a pediatric component called the Discovery trial, and that's about to get started, and we would hope that, if possible, our children could also be enrolled in that study. Immune modulators are being used for the cytokine storm, and here at the University Hospital of the West Indies, we have tocilizumab and we have anakinra available, and as time goes by, if needed, we would hope that these would be available for our children as well. Now, in the last few weeks, and certainly last week, we've been hearing on the news how there are several children, over 100 of all ages in Britain, United States, France, Italy, Spain, and Switzerland, who have now developed a new pediatric disease called the Pediatric Multisystemic Inflammatory Syndrome, PIMS. And it looks just like Kawasaki's disease or even like toxic shock syndrome when it presents with the multisystemic presentations. And what is happening is that children in Europe and the United States are presenting with sudden abdominal pain and severe hypotension and shock, with a preceding period of fever, rash, and then they may have myocarditis and pericarditis and multisystemic presentations. These are causing them to be admitted to the intensive care unit, where they are being treated with mechanical ventilation and they're being managed for shock. Kawasaki's disease, we will remember, is an illness that has been around for about 70 years, and it is characterized by prolonged fever, rash, red eyes, swollen red hands and feet, and cervical lymphadenopathy. What really happens is that it's a post-inflammatory illness where the arteries of the body get inflamed. And we worry most about the coronary arteries because with the coronary arteritis, they get ballooning of the coronary arteries with aneurysmal dilatation, and sometimes you get thrombosis. And this is the challenge, the big challenge with these children. So intravenous gamma globulin, when given early in this illness, will reduce these complications from 25% to 5%. I must say that this illness is very rare. It occurs in spring, and here in Jamaica we see it maybe 1 or 2 or 3 cases each spring, or sometimes we don't see it at all. It's linked across the world to various viruses, but no one virus has been consistently associated with it. And then sometimes the children that are presenting with PIMS around the world may also have something that looks like toxic shock syndrome, where they have shock, fever, rash, and a multisystemic presentation, which involves the systems of almost all of the body: the heart, the kidney, the lungs, the brain, the blood, the liver, the gastrointestinal tract, and the skin. Now, toxic shock syndrome, we know, has been associated with Staph aureus infections in the past, and retained tampons in young ladies, and surgical nasal packs, we know that. Or it can be related to group A strep infections. And the toxic shock syndrome 1 and toxic shock syndrome 2 have been identified. In this new pediatric multisystemic inflammatory syndrome, or PIMS, the blood parameters seem consistent, however, with severe COVID-19 infection in children. A paper that was just published last week reported that the children were mostly asymptomatic, and not only would they have those clinical features, but they had high D-dimers, high troponin, ferritin, procalcitonin, triglycerides, and CRP was positive, as would patients with COVID-19. And what was interesting is that these patients were either known to be exposed to COVID-19, or they may have tested positive for SARS-CoV-2 infection, whether by a PCR or by an antibody test. In New York, as of yesterday, from what I could gather, of 93 cases, there were 5 deaths to date. So the question people from all over the world are asking, including our pediatricians, is PIMS an exaggerated immune response that mimics the post-inflammatory cytokine storm from COVID-19? And here we have a case history from the University of the West Indies. A teaser. This is a 12-year-old who presented with fever, dry cough, shortness of breath for 5 days. She was previously well, without underlying disease, related history, or known contacts. She and her family had been adhering to curfew and had been she was transferred to UHWI on the 6th day of illness from an outlying hospital. Her clinical features were significant for mild cardiopulmonary distress, tachypnea, fever, generalized edema, right and left basal crepitations in the lung, and hepatomegaly. Her hemoglobin was very low at 2.8 grams per deciliter. White cell count was elevated with neutrophilia. Her platelets, serum sodium, and serum albumin were all low. Liver function tests were elevated. Her CPK was 338. Her D-dimers were almost 44,000. Her serum troponin over 72, almost 72,000, and her ferritin over 5,000. Her SARS-CoV-2 nasopharyngeal swabs were PCR negative twice on days 4 and day 6, and her rapid IgM antibody was negative on day 7. Typical for COVID-19, we thought, was her chest CT, which showed ground glass opacities in the right and left lung, which were more prominent in the right mid-zone and the right upper zone, and more marked peripherally. There was also crazy paving, a right basal consolidation bands, and 50 to 70% in the right lung and 25% in the left lung. That was significant. We felt, too, that her clinical presentation, along with her hypercoagulable state, the thrombosis, her high troponin, and her D-dimer and ferritins, appeared typical for COVID-19. However, what was atypical for COVID-19 was bilateral pleural effusions, more so in the right versus the left chest, and severe anemia. Could this be another unusual post-inflammatory presentation of COVID-19? And when we review the guidelines from the Royal College of Child Health and Pediatrics, we really have to ask ourselves that question. This child is, however, doing very well on blood transfusions, antibiotics, anticoagulants, and supportive care, and her investigations are ongoing. So parents might be a little bit concerned. First, we say that this illness is mild or asymptomatic, and now we're saying that you need to look out for pediatric multi-inflammatory syndrome. When should you go to the doctor? When should you ask a question? First, you may have a child who had a recent prodromal mild flu-like illness, or you may have a child who was asymptomatic, and then this child suddenly presents with fever, difficulty feeding, severe abdominal pain with diarrhea and vomiting, trouble breathing, a racing heart or chest pain, decreased amount of urine or frequency of urine, lethargy, irritability or confusion, a change in skin color, and maybe even sudden fainting or collapse. This child should be rushed to the hospital emergency room. There are several long-term complications that occur in adults: Guillain-Barré syndrome, hemorrhagic necrotizing encephalopathy, chronic lung disease, cardiac manifestations, renal manifestations of acute kidney injury, which later on do not necessarily get better, hepatic injury with abnormal liver function tests that are sustained, and dermatological lesions. You would have heard about COVID toes, and then there's the chronic fatigue and low-grade fevers of this illness. While these are not yet being seen in children, because this is an evolving illness, we should still look out for these. A word about perinatal and newborn health. The Pan American Health Organization recently went through a systematic review, and essentially of 256 publications, they identified 20 for more detailed review, and they found 222 women, pregnant women, with suspect or confirmed SARS-CoV-2 infection, or newborns who were referred with SARS-CoV-2 infection. These papers came mostly from China. And from these, there were 13 babies who were reported to be positive for SARS-CoV. The majority were asymptomatic or had mild symptoms, and there were no adverse perinatal outcomes reported in any of these studies. There was moderate or severe clinical features in a few, and no positive results for SARS-CoV-2 identified by the umbilical cord, placenta, or amniotic fluid. Pneumonia imaging revealed increased lung markings or nodular shadowing. There were minor biochemical abnormalities, or the breast milk was negative for SARS-CoV-2 in the 24 women from 8 papers. So mother-to-child transmission cannot be confirmed or denied, was the conclusion, and also that the current literature does not support abstaining from breastfeeding or separating mothers and newborns. But of course, more data is needed from this part of the world to establish definitive guidance and recommendations. A word about pets. How could I close without not speaking about pets? SARS-CoV-2 human-to-animal transmission has been identified, with animals testing positive after human exposure. So there were 8 tigers and lions in the Bronx Zoo that were exposed to an asymptomatic animal handler. And then there was a dog who became positive and symptomatic after being exposed to his emergency room physician owner and his child. And also another family dog and cat became positive as well. There were also 2 pet cats reported by the CDC. And in China, our colleagues reported a 15% seropositivity for SARS-CoV-2 among 100 stray, shelter, and domestic cats. The CDC has concluded that people are the most likely main drivers of this, with human-to-animal exposure. But I think we should pay a little attention to this, remembering that the virus came from animals to humans. And the recommendation is that social distancing is not just for people, but also for cats. So in conclusion, pediatric COVID-19 is primarily a mild disease. Asymptomatic cases seem prevalent through contact tracing. Fever or cough may be absent, and very few appear to require hospitalization. However, in recent times, children are presenting with atypical pediatric multisystemic inflammatory syndrome, PIMS, with shock, which mimics the syndrome of Kawasaki disease or toxic shock syndrome. These children require ICU admission to save their lives. We should also be looking out for other long-term post-infectious multisystemic complications that may evolve, as we are seeing in the adult population. Children with less serious disease and asymptomatic cases may also be important in disease transmission. Social distancing and preventive behaviors remain important for all age groups, including children, and infection transmission must be carefully considered and mitigated before any consideration for reopening of schools. Currently, the presentation and outcomes in Jamaican children and in children from the Caribbean are being explored in a collaborative multidisciplinary model. We hope this project will bear fruit. Thank you very much.
Thank you very much, Professor Christie, for giving us really a broad perspective in terms of the COVID-19 experience in children, looking at clinical features, looking at the epidemiological features, and introducing us to getting an insight into PIMS, the Pediatric Multisystem Inflammatory Syndrome. You've shared with us, in fact, a very interesting case already that you referred to from our own university hospital. And it's of note then that we're saying that this is something that we are keeping an eye out for, and we are on the ball in terms of the management and getting up to speed, as you say, to it. I think a good point you ended on is really exploring the outcomes in our Jamaican and Caribbean children. And I think we have what it takes within our Caribbean region, within our universities, our hospitals. We have the scientists very much at work on this area. So thanks again for a very detailed presentation on and getting the ball rolling, opening the batting on the COVID-19 experience in children in the Caribbean. Thank you very much, Prof. So we just heard about the epidemiology and the clinical aspects of COVID-19 in the childhood adolescent population. And now we're going to move, we're still in that, it's all about children and families today. And now we're going to look at the issue of mental health in our children in COVID-19. And I'm very happy to invite and to present to you Professor Maureen Sams-Vaughan, who will speak on this topic. Professor Sams-Vaughan is Professor of Child Health, Child Development and Behavior in the Department of Child and Adolescent Health right here at the University of the West Indies here on the Mona campus. And she's well placed to speak to us on this whole aspect of child development and mental health. Professor Sams-Vaughan was the former chairman of the Early Childhood Commission of Jamaica. And in fact, she started that commission in 2003, following landmark research that she conducted, looking at issues to do with early childhood development in Jamaica. And out of that research, she herself was driven and called on and commissioned, I would say, to use that term, to move in the direction of setting up the commission, this Early Childhood Commission, which still has grown today and is playing a significant role in terms of our issues to do with child development in Jamaica. So we're very happy to have with us our distinguished professor who is going to share with us some insights and aspects to do with children's mental health during COVID-19. Let's welcome Professor Maureen Sams-Vaughan.
Thank you, Dean. Well, after focusing on children's physical health, now we're going to focus on children's mental health. We're going to find out just what happened to our children since this pandemic. We're going to talk about what's normal. When children have had these kinds of experiences, what's normal? And then we're going to talk about how do we prevent them having serious mental health conditions. Then we're going to talk about what are those serious conditions? How will we recognize them? What should we do if we see them? And what implications do we have for the future? So what do we know about this experience of COVID-19? Well, pretty much none of us have lived through anything like this. The closest we can recall is the H1N1 or the swine flu pandemic in 2009 to 2010. And that affected persons primarily in the United States, Mexico, Canada. Canada was an epicenter. And then we had the Ebola epidemic in 2014 to 2016. Those of us in the Caribbean region, we prepared for it, but we were very happy that we didn't actually have to deal with it. We did have to deal with the Zika epidemic, but that was nothing like what we are seeing today. But to be real, pandemics have been present throughout our human lifetime. Now, a pandemic is a type of disaster, but it is a disaster that has health implications. Both disasters and pandemics are unpredictable. You all understand what that means for sure. They have a community impact, they have fatalities, and they have persistent effects. But one difference between pandemics and disasters is that when we respond to disasters, we often bring people together. So we form support groups and we get people to talk about their experiences. In pandemics, we do just the opposite. We separate people. We isolate people because it's absolutely necessary. So that's a huge difference between a disaster and a pandemic. Now let's see what has happened to a child. What was happening to children as we were going through this timeline in Jamaica? Well, on Wednesday, March 11th, WHO declared the pandemic. Maybe children weren't paying too much attention to that. But certainly, on Thursday, March 12th, when the first COVID-19 case happened in Jamaica, even if children weren't paying immediate attention to that on the news, their parents certainly were. Their parents got anxious. I'm sure all of us can remember where we were when that first case was identified. So children would have seen that anxiety. Then almost immediately, the closure of school was announced on Thursday, and it happened the next day. So children were just thrown into turmoil immediately. Then, shortly after that, they heard that people in certain communities were being locked away, and they wondered whether their community was going to be next. Then, other changes started happening. Within a few days, their parents were home. They couldn't go out. They couldn't go out to any places of entertainment. And then, just as they were trying to adjust to that, somebody died. And the fact that someone died made children think that anyone close to them could also die. And then our borders closed. I want you to think of how those changes happened. They happened for us as adults, but they also happened for children. Then something else happened within a few days. Nighttime curfew started. Then by April 9th, wearing of masks for the vulnerable was recommended. Okay, some children thought this was cool for a while, but by April 21st, when you had to wear it all the time, it probably wasn't so cool for children. And then as they settled in with that, they heard that a child died, April 23rd. The fact that a child died meant that they could die. And that created another level of anxiety for them. So if we think of how quickly things happened for children, we can understand the feelings that they have. So in rapid succession, they had the anxiety of persons around them. They had almost constant information from the news and the media, daily counts. They had disruption in their normal school life. They had disruption in their normal home life. They had disruption in their social life. They were away from their peers. They were isolated. There was anxiety as adults became ill and died, and there was worsening anxiety as a child died. That was a lot for our children. And then we also have to think of children who were in special circumstances. We had children who had COVID-19. You heard about some of that just before this talk. Then there were children who had ill friends and relatives. There were children who lost friends and relatives. There were children who were living in quarantine communities. And there were children who were scared when their parents went to work every day because they were frontline workers. Separate and apart from the COVID-19 related special circumstances, there were children with chronic illnesses who typically went to hospital frequently. They had concerns. There were children with disabilities who have special needs. They had concerns. And there were children in poverty who also had concerns about how they would manage. Well, what's typical? Once our children get exposed to these stressors, what's typical? Some children respond by having behavioral changes. So they get moody, they get irritable, they get a little bit more aggressive, and some get a little bit more clingy. When parents are going out to work, they may be hanging on to them more. You know, when they're asked to do a chore, they may be a little more upset. Some of them respond by withdrawing a little bit from their family or their friends. They may have more arguments with their brothers and sisters or other persons in the home. Some parents may see their activity levels increase. They become hyperactive. Some may see their activity levels decrease. Some of them just want to sleep all day. There may be difficulty concentrating, especially with parents trying to get them to do schoolwork. You might find it difficult to have them concentrate. Some of them are so active they find it difficult to rest or relax. Some children change their eating habits. Some eat too much, some eat too little. Some change their sleep patterns. Some sleep too much, some sleep too little. There may be change in bowel or bladder habits, especially in the younger children. Children who are under stress may start bedwetting when they had stopped bedwetting some time ago. Children may seem more fearful. They may be afraid of the dark. They may be afraid of being alone. They may be afraid of strangers. Children may also develop some nervous habits, such as nail biting or rocking, lots of different habits. So these are things that common responses that children may have to stress. And most times, we can help children through these by just being understanding. But how can we make sure that we can try to prevent these disorders getting more severe than just what we consider typical okay changes in behavior? First, it's important for parents to look after their physical and mental health. You've heard a lot about first responder. You are the first responder in your home. You have to be healthy to help your child. And your mental health needs to be good because children will pick up on your fears and your anxieties. The second important preventive measure is to encourage routines. Children, like adults, prefer when life is predictable. You have a job, you get up every morning, you dress, you go to work, you come home, you relax. We all like when life is predictable. For children, the typical school routine is no longer present. Life is no longer predictable. Even when your home was chaotic, when children went to school, school was very predictable. School had a particular schedule. So what has to happen now is that you have to develop new family routines that work. And your routine may be different from somebody else's, but you have to do what works for you. It's important that you discuss and share those routines with your child. In fact, ask your child to help you develop the routine. And for children who can't read, you can use pictures to show the routines for them. You can have a picture of your child getting out of bed, then a child having breakfast, then a child settling down to do some schoolwork. And you just point to the routines, point to each picture as you're changing routines. Encourage your children to speak or otherwise express how they're feeling. They could express how they're feeling by drawing, by acting, by playing. But you need to truly listen and participate. Washing the dishes and just giving an occasional eye is not truly listening and participating. It's important when children are stressed and stressed for long periods like this pandemic that you really listen. And it's also important to share your own feelings with them. When children understand that you have a little concern too, and hear how you're addressing your concern, they will learn that it's okay for their feelings, but it's also okay to find a solution. Give extra hugs, extra kisses, and extra praise. Children who are stressed need this. Find ways for your children to keep in touch with family members and peers. we physically distance, we can be socially close. Reduce exposure to media and the screens. Now, I know a lot of media is being used because a lot of schoolwork is being done like that. What I'm talking about, though, is frequent reports on the pandemic. Children can't often put them in context, and it can be very scary. Keep children engaged in activities, but also remember that just like you, downtime and free time is important. Ensure a healthy diet, rest, and physical exercise. Now, what have we learned about the more serious illnesses? Well, when they did parent surveys following the H1N1 in North America and in Mexico, they found that there was post-traumatic stress disorder in almost 1 out of every 3 children who had been isolated or quarantined. They also found that that happened for 25% of parents. So both parents and children had some difficulties with isolation and quarantine. And it was also found, remember I said to look after yourself, because it was also found that where adults had PTSD, the children were more likely to have PTSD. When the children who had received mental health services were looked at, they also were found to have generalized anxiety disorder. They worried about things that they shouldn't worry about, everyday things. They were fearful of everyday things. They also had adjustment disorders. An adjustment disorder is an unusually intense or prolonged response to a stressful event. We all have responses to stressful events, but an adjustment disorder is when it's very intense or very prolonged. And when they looked at the children who actually got mental health services, they actually only found the post-traumatic stress disorder in just over 1%. But as I showed you earlier, when we looked at all children and adults, even those who did not receive mental health services, we found that more children and adults had post-traumatic stress disorder. In Wuhan, in China, they found that almost 1 in 5 children were depressed after they had been in lockdown for a week. Depression may present with severe withdrawal and severe withdrawal of eating and inability to sleep. They also had children who had anxiety. This was after 30 days of lockdown. So we've talked about some of the more serious mental health conditions that can occur, but before that, we talked about how to prevent those. Now we want to address when should you seek help for your child. If your child's behavior is very different from what you're accustomed to, you should seek help. If your child's new behavior is continuing for a long time and it doesn't seem to respond to your attempts to help, you should seek help. Really, what I'm saying is that if you are seriously concerned about your child, it's always best to seek help. And where should you seek help? The Ministry of Education, Youth and Information has established a number of parenting hotlines. Some of them are on the screen, but there are others in all parishes. Please check. There are, I think, some 36 different lines that you can call. So that's somewhere that you can just stay in the comfort of your home and get some help from. Other places that you can seek help is your nearest healthcare provider, whether that be your well child clinic, your family doctor, or your pediatrician. You can also seek help from your church counselor, from your child's teacher or guidance counselor. Many of you are in touch with your teachers and guidance counselors, even in this pandemic. But seek help from a professional who can provide you with the right guidance. However, as we look forward, there are long-term implications for this in that some children may have conditions that don't get identified until much later on. It will therefore be important at a policy level, at a government level, and at training institutional levels that we train our teachers, our healthcare workers, our pastors, and others to identify children and families suffering from trauma, to provide them with first contact support, and to be able to refer them on if we think they need further help. Thank you for listening. I hope this has helped you to understand a little bit how children experience mental health challenges and how you can help your children in your own home. Thank you.
Thank you very much, Professor Samsworn, for taking us into that very vivid description of what is happening to our children in terms of their mental health vis-a-vis COVID-19, and putting some hope, I think, too, that we can, with interventions, you talk about counseling and addressing the PTSD and all of that, that we can see a difference in terms of the development of our children. At the heart and soul of what we're looking at today is children and families, and I think it's good to see that we can focus on what I call an important group. I don't want to say vulnerable, that word is somewhat overused, but certainly a group that is very much critical to our future. And to hear of the attention that is being paid to the mental health of children and their well-being, it's very reassuring. So I hope that we heard the lessons that Prof raised and raised the pointers that she raised, and that we'll take home these and start having that positive attitude in terms of dealing with our children in our communities and in our homes. Thank you very much, Professor Samsworn. Thanks. COVID-19 has brought a lot of innovation and reflections to our environment. And one area is the whole concept of school. You know, we know school, all of us went to school, right? Building, teachers, blackboards, etc. And now with social distancing and so-called remote learning, there's interesting questions about what is school looking like. School is out, but school is in. This morning, I'm very happy to have with us Dr. Kassan Troop, who is the Acting Chief Education Officer in the Ministry of Education, Youth, and Information here in Jamaica. Dr. Kassan Troop is a teacher going way back. Her heart and soul is in teaching. Teaching administration, innovation. She was a previous principal here in Jamaica, served very well in a distinguished manner. And now she's flying the flag at a higher level in terms of the administration over the islands, as Chief Education Officer over the islands' education services. So we're very happy to have her here now to speak, looking at the learning initiatives under COVID-19 and some of the innovations that we are practicing and that we have brought to the table during this period. Let's welcome Dr. Kassan Troop.
Thank you so much for that wonderful introduction. I'm really happy to be here to share with my colleagues what we have done in Jamaica and the kind of partnership that we have brokered across the region. I mean, education is the great equalizer, and every child has a right to an education. So though we are challenged with this pandemic, it is very important that as a country, we respond to the educational needs of our society. This is what the Ministry of Education did. We made that decision because we believe in the rights of children. We believe that we have a responsibility to make the adjustments. Every education system has to be adaptive, responsive, and agile. And this is what COVID-19 dictates. So what we did as a ministry, as soon as we were alerted by our health sector and what was happening globally in Jamaica, we developed what we call our EIE COVID response plan, that is Education in Emergencies COVID response plan. And that was divided into 3 phases. Phase 1 was called the Green Alert, and phase 2 was called the Amber Alert, and then we went into the Red Alert. And of course, Green Alert, we focused on educating our people, our children, our parents, our teachers, and what they need to do now, the precautions that they need to take, you know, just to make sure that they are practicing good hygiene, they are sanitizing. And then once we got wind that there was a case in Jamaica, we had to shift quickly into the Amber Alert. In that phase, we actually gave more funding resources to our schools, because now they will have to go into deeper and more extensive sanitization. And that is what is required in a time like this, because we have to keep our children and our teachers safe. So we got to provide resources for them. We got to give more instructions. We were providing the health instructions. We worked with the Ministry of Health to make sure that everything that they said that needed to be done, that our schools were involved in that. And that is very important because we have to protect our children. And then the red alert came on March 13, we had to close. And we had to shift into another gear of transitioning our education system from the day-to-day interface into what we call emergency remote teaching. And I want to stress on that because I know my colleagues around the territory, we tend to focus a lot on the online version or modality, but we have been trying to change that rhetoric. When we talk about education in emergencies, there's no over-reliance on any one modality. And especially now, when internet is so expensive, especially mobile internet, we have been pushing in Jamaica a mixed modality approach for our education system. So what have we done? We have been sharing. As soon as this thing started, we have got together with our Caribbean islands. We started to discuss strategies, approaches, and you would have seen that a number of our territories responded in a similar way. So territories would have closed their schools and they would have transitioned into radio education or online education, televised education, and of course, all countries would have been challenged with those in the deep rural areas or the rural areas. So we had to also include in that mixed modality the learning kits, having printed materials available to our children and making sure that the facilities were in place for that. So quickly the Ministry of Education equipped our regional offices with printing services because we knew that the schools could not carry this. This would be extensive printing. So we had to augment that to make sure that no child is left behind. That's our mantra. We cannot leave any child behind, irrespective of the challenges. We have to just listen to what is happening on the ground and make the changes as soon as possible because every child matters. So this is what has been happening along around the country, around the territories. Persons have been sharing. We are sharing content. We are giving access to our content. We are now in partnership with UNICEF and IDB and PAHO. All of those international agencies would have come on board to support us. But what I'm most proud of, so though the ministry would have said we are transitioning into a mixed modality emergency remote teaching, we have seen some creativity. And this is right across the region. I mean, we have a little school called Little Bay, all the way in Westmoreland. And they were challenged because their children were not able to access the online facility, which is the easiest way of making sure that you are engaged in today's society. It's quick, it's available, the internet is there, the WhatsApp is there, and so. But these children were not able, and this principal said, I have a responsibility to make sure that my children are not left behind. And he went into contacting the Ministry of Education, printing his learning kits, packaged it specially. The children's names were written on the package. And he rented a bike taxi every day. And he would go around to the communities. And I can tell you, the parents were most appreciative. The children were happy to just see their principal. Because guess what? In this pandemic, the children are missing their teachers, they're missing their parents, they're missing their friends rather. And so when they saw their principal in this scenario, they were most ecstatic and they are willing, they are returning the work, they are collecting the work weekly, and they felt special. This is a kind of innovation taking place in COVID-19. I'm proud to boast again, this initiative now is from a teacher in a very small school in the inner city, Union Gardens Infant School. These are our babies. And this teacher said to us, I felt challenged. I don't like the technology. And she thought about parents who may feel the same way. And she went into the community. She noticed that there was a blackboard in a community space. And she discussed with the resident and said, may I borrow this space? She painted it and started to put the content on the blackboard every morning. Between 8 o'clock to 10 o'clock, she's in the field, and then she would go back home and then continue the conversation and the feedback via WhatsApp, text message, telephone call. She replicated that in another 5 communities that the school served. And the parents, again, you would see a picture there of a daddy, and I'm so proud that it's a daddy. you know, because we want to see our fathers involved in education. And the children will go and they will take the notes with their parents. And of course, they will take the pictures for those who don't like to write. And they will go back home and they will engage with their children. But what was most instructive, that this teacher, who didn't like technology, she also thought about how difficult it was for the parents to use the WhatsApp and the other, you know, devices that they have available. And she said, you know what, I'm going to teach the parents how to do this thing. And she had a parent-centered virtual classroom teaching the parents how to help your children to learn. And they were ecstatic. You know, they said, I can't believe I can do it. It's almost a sense of self-efficacy. They're saying, I can teach, I can help my child. And this is another success story coming out of the COVID-19. And of course, the police is not to be left out. Our police officers in West Kingston called the Ministry of Education and said, guess what? I work in the inner city and I'm seeing some children, too many. So I'm thinking something is not happening. What can we do to help? And they suggested to us that we can distribute, we can find these children, find their homes. We can identify centers within the communities that are accessible. We would like to get these packages and we will distribute. And yes, we partnered with them. And every day, Mondays to Fridays, they come, they pick up, they distribute. There are established centers in the communities, and the parents will go in and collect, and they will return. We take them to the ministry, we mark them in collaboration with our teachers, and we send them back for feedback. These are the kinds of initiatives taking place under COVID-19. And of course, the technology. Red Bank said, guess what? We need some more tablets, we need support. And they went out and they got persons within their communities to donate. And so they gave the tablets to those who were challenged. And then they cooked. Of course, we have to talk about the nutritional support of our children during a time of disaster. And so this institution, they cook. 100 meals are provided daily for parents and children who are challenged, those who are the most vulnerable. Now, we can't leave out the psychosocial support. In our education system right across the region, we have what we call guidance counselors and social workers. So what we did as a ministry is to galvanize that team to say, remember, this is a period of transition. People need to cope. Some persons are fearful, some persons are stressed, teachers don't know what to do, parents don't know what to do. We need your skill set. So we had the guidance counselors pooling together and reaching out to educators, reaching out to parents, calling. We have said to our principals, give the guidance counselors the resources to call. A call makes a difference. And they have been calling, they have been counselors for each other, and they have been counseling, and especially those schools that are small and don't have a guidance counselor on staff, those schools have been given priority. So we have what we call a crisis management team that is already established. Now those teams had to go into another gear of preparation to provide the psychosocial care. So we are really, really pleased with what is happening. Now you would have heard that a lot of persons would want to have mobile data because this is more accessible and desired, highly desired. So we had our Jamaica Teaching Council saying, okay, we're going to take on the cost of this. They have provided roving modems into communities that are underserved by the national infrastructure. So we have the education officers and the regional directors set up the roving mobile at different locations at different times within different communities to provide access to those children. Because in the mixed modality, we would have said it is okay for about 2 hours of online interaction for that face-to-face, for that interaction and feedback. So we wanted to provide that facility. And this is what is happening in the rural areas. We are not leaving them out. And of course, the radio drama. One of the media options that is always available and always with us is the radio. And of course, in the EIE plans, we know radio education will be the way forward if it is even a hurricane or an earthquake. Most times, the only source of media that is with us is the radio. So we had to capitalize on this. So we have the Region 5, Region 2 and 6, which are rural communities. They partner together and they develop their radio drama to look at, and with the famous term, Tanaya Yard, and then of course we say stay at home. So we look at that concept and we look at, and we integrate that in the math, the core areas of math, English, science, and social studies. So those are the core areas of the primary division. And of course, we have the parent feedback. We didn't want to leave the parents out. So this is not just about the psychosocial. So when we are treating with an adjustment of this nature where parents are playing a more integral role in the teaching and learning process, we have to hear from them. So we have something called a life project where the parents just take the pictures and send to us about myself engaging with my child, what it feels like, what it looks like. And this is very important for us because we want the parents to know that we value them at this time and we understand the adjustments that are taking place. But when we can send a commendation to a parent and when they can look forward to a pat on the shoulder in cyberspace, that is very important into the transition into COVID-19 and the EIE plan. So what did we do in addition to all those innovations? And these are the things that triggered the kind of thinking on the ground. The ministry moved quickly into a modified national timetable because we saw the need that we had to pull it together. And a lot of our stakeholders will be relying on us for leadership. This is new normal. So we had to say, principals, if you're not able to coordinate on the ground, you can set up your program around a national timetable that we would have offered, and we would have put in the enablements in that. So we had a televised program, and we partnered with TVJ, we partnered with Ready TV, we have partnered with CVM and PBCJ. And Ready TV is a new development to address those in the rural areas that are now denied. So we are now getting our own, the Ministry of Education has now moved into our own educational channel. And that is just something that we're going to be building on beyond COVID. We have online learning taking place in partnership with our learning management providers. We have, as I said, radio, TV, and guess what? We had to move into partnership quickly with our internet support plans because a number of our students and parents would be relying on that. So we negotiated early for a reduction in the cost of mobile data. And the organizations, they have been very good to us. They have listened and they have partnered. And in addition to that, they have provided zero-rated sites. So the sites that the children are using, they are now able, under this plan, reduced plan by up to 60 to 70%, they are now able to use the sites that they are familiar with and that they are using in their program free of cost. So that is very, very important. Now, we had to transition quickly, so we had to be training our teachers. This is a new normal for our teachers and our principals. So our principals had to get engaged in online discussions very quickly as to how do I adjust. We provide that enablement and support. Right now, our National College for Educational Leadership will be launching a full-fledged virtual instruction leadership course for all our principals across the island. We had to adjust quickly. So that program is now in place. And of course, our teachers, our learning management providers would have started training our teachers immediately. As soon as we announced the transition, training was available. Our Jamaica Teaching Council remodeled immediately, and training is available ongoing for our teachers. And of course, we are partnering now with the UWI Open Campus to offer another level of training and certification for our teachers. So we are extremely happy for the kind of responses and the kind of support. Now, in addition to the training, we had to provide some guidelines. As I said, it's new. How do I lead an institution? How do I do the normal manual things in electronic space or away from school? So the ministry actually developed what we call an Education in Emergencies administration guideline. So that is what the teachers, the principals will use to say, how do I account for attendance? How do I account for monitoring teaching and learning? You know, how do I ensure that I'm communicating? How do I use the resource to facilitate communication? How do I facilitate assessment? No, assessment policies and programs would have been disrupted. So we had to provide this kind of guideline in the best interest of our students. We also moved beyond just a guideline. We provided tools, e-management tools. So a principal may want to mark the register in an electronic format. We provided that support. A teacher may want to upload a plan for a teacher, a cooperating teacher to review. We provided that support. And those kind of templates and tools, they have now been included in our principal training going forward. This is a new normal. The impact of COVID will be with us for a while. So these are things that we will take forward. And as I said, we never know what is coming next. So we will be prepared coming out of COVID. And of course, our international partnerships, we continue discussion with the region and with our PAHO, and UNICEF has been great to us, providing resources for PPE, and just guidance and access to content materials for our televised programs. We moved quickly into modified exams, so you are aware of what's happening with the CXC exams. We do also the City and Guilds in Jamaica and the NCT VET. So we have been in discussion. We went quickly into discussion with our examining bodies to make sure that the decisions that we take, they are in the best interest of our students. So we have modified assessment approaches available now. Many persons would have been concerned about what happens to the internal process. So we have been dialoguing with our exit examining bodies. But internally, some children are disadvantaged, regardless of what we have done, and in spite of how we feel, some children are not being adequately met. So will they be disadvantaged? These are things that we discuss as educators. So there is the process of the curriculum crosswalk, where we assist our school leaders and our teachers to assess where our children are. And as a ministry, what we have decided to do is to make sure that those instruments are developed. We are the ones who wrote the curriculum. We are the implementers of the curriculum. We are aware of what is supposed to be taught when. So we are using that information to develop the instrument that will support the teachers in assessing the children when they resume. Because as Jamaica, we have taken the decision for children to progress. So we are believing that they will be able to adjust going forward, and we will now use the curriculum crosswalk, build the bridge to fill the gaps, and support the children going forward. If it means that some children will need enrichment programs, we will provide the resource for that, because that's why we are here. Now, we had to support our parents. We have a National Parenting Support Commission in Jamaica. So they went full-fledged into work right as we are trying to respond to the educational needs. They started to look at the parents. So we did some quick videos for parents, quick tips. How do you make the adjustment at home? How do you support your children? How do you deal with your own fears? You are losing a job. Some of us are losing jobs. You know, how do you monitor while you have to attend to the work while working from home? So all of that, we did short videos to help our parents to adjust. And then, with the support of UNICEF, we established our helplines. So we had right across the island 36 helplines available for parents to just call, to talk to us, to whatever questions they may have. And of course, these persons were trained, and they're able to refer the parents to the ideal location. So the psychosocial helplines were made available for our parents. The educational tips were made available. As a Ministry of Education, the nutritional factor is very important to us. We operate one of the largest nutrition programs in our schools. Approximately 200,000 children are fed daily in our schools in Jamaica. So we had to facilitate that. So, of course, initially we had to provide the meals on a daily basis using our resources. So we distributed, and the parents will come and pick up. And then once we were able to transition into the cash grants in partnership with the Ministry of Labour and Social Security, we were able now to move away from the products into cash being available to the parents to support the nutritional need, because that is very, very important. A number of our schools, as I said, continue to cook, continue to deliver. We also gave the directive to our principals to package the food materials that they would have procured for the canteen operations, to package those and to give to the parents who are in need. So we have been responding to that, and now the parents get their cash grants monthly, with their usual payments. And of course, the technological support, we are challenged at this time because of the over-reliance on the technology in this modality. But what we have done, we have started our procurement process to add to what we now have in the system, 40,000 tablets. Our partners would have been calling us to say we would like to augment that. So the Digital Foundation would have called to say we are going to give you 1,000. And we want to make sure that the special education children are priority. And they would have said to us 600 of those 1,000 will go to the special ed, and you have 400 to assist. The ministry also will procure additional tablets to make sure that those who are denied access, they will be served first. And those are normally the most vulnerable in our society. We have to evaluate the reach. So as you do your COVID-19 response, and as you look at your education, and as you look at your best efforts, you need to know, are you making any impact? What can you do better? So we had to do quick audits and surveys through our regions to find out what are the challenges, what are the successes. And our minister moved quickly into having online consultations with our principals. So we will have 600 principals in any day discussing with our minister what I have been doing. I remember one principal said to us, though she's not in favor of what is happening with the transition, but she had her best PTA in terms of attendance virtually. So parents logged on to the Zoom platform and they had a fulsome discussion, and they would have said, we want to access the tablets, we want to help. Parents were just expressing how much they want to support their children, they don't want them to be left behind. And then we listened to them, and we were able to adjust to say, okay, what do you now have at school? How can you make that available to the children? And the principals will give suggestions as to how else we can make what we are doing better. So those stations, those radio stations that they could not reach, we had to now broker partnership with local radio stations to make sure that those children are not denied. So this is the kind of communication that is happening. We are nowhere near what we want, and it's an emergency, and I keep saying that. So we're not going to get it perfect, but we must never stop trying to make sure that our children, their needs are met. Education is the great equalizer. Education is a right for every single child, and every country must put the steps and the decisions in place to ensure that no child is left behind. So where are we now in Jamaica and the rest of the Caribbean? We're looking at resumption plans. Now, this is a major one for us because we still have to observe the social distances. So we have to ensure that our schools, they are clean. They have been shut down for a while. So deep cleaning has to take place now. We have to look at transportation and the logistics in that. So, I mean, some areas are more fortunate than others, but we have to think about those things. How can we navigate that? We have in excess of 500,000 children in our school system. So we have to consider that. We have to look at additional wash stations in our schools. We have to do an audit to say, is this sufficient? We have to give additional resources to deal with the sanitization throughout the day. You know, we have to review exam policies. We have a big exam looming now, and we have to look to see, can our grade 11, 12, and 13 students resume? How will that look? You know, how do they gather? How do we seat them, recognizing the 6 feet apart? How do we feed them, recognizing that they can't gather? You know, these are some of the things that we are thinking of. Do we do a staggered resumption? Do we do a shift? Do we rove? Do we do a blended approach? Do we support the hybrid model, you know, where there's some amount of physical face-to-face interface and online? But the online modality is here to stay. So we just have to look to see how best we can make this work. So social distancing is key going forward, and we will continue our partnership with the Ministry of Health to make sure that we never compromise those standards, because the life of every child matters, not just the education, but the life of every child matters, and the life of our stakeholders, that matters. So we continue to serve, we continue to respond, we continue to dialogue, and we are most appreciative of our partners. This is a new normal. Health and wellness is priority as we resume. Focus on quality and equity. So what this disaster has done, or this pandemic has done, has really highlighted some of the inequities in our system. We have to now refocus on those. We are now pushing for creativity and innovations, ongoing training, psychosocial and nutritional support, parental involvement, very key. An education system at this time has to be flexible and adaptive. We have to make sure that we are communicating and, of course, monitoring. What gets measured gets done. So we can't just leave the system out there. We have to provide the monitoring support. We have to guide. We have to communicate. And this is where we are as we adjust to the new normal. Education in emergencies is a difficult time for every country, for everyone. But once all our stakeholders pull together, we can do this. Education is a great equalizer. Let us put all our effort in to make sure our children can stand and they can be successful in the future. Thank you.
Thank you very much, Dr. Troop. Lots of lessons in there, huh? Lots of lessons for us. What a transformation. The question of talking about emergency remote teaching as opposed to online learning. And certainly we see in the emergency response, we heard, this is a case study, I would say, from the Jamaican experience, but I think the lessons are pertinent and replicated across the region, as all of you joining us from across the region and even outside of the Caribbean. There are a lot of lessons in terms of innovation. and partnerships. We heard partnership with UNICEF. UNICEF, by the way, is on the program. Later on, you will hear from a UNICEF representative. Partnership with private sector, with parents. An extremely exciting innovation in some of our rural areas in terms of the commitment that parents and teachers and administrators, members of the ministry are saying, we got to do this, huh? Regardless of what it takes, we'll get it done. If it means painting over a blackboard in the community, getting the, what you call it, the district bicycle bus, is it? The bike to go around and drop things off. So I think you'd agree with me that we have had a very exciting presentation and a lot of things to reflect on. We're looking at COVID-19, the impact on children and families in the Caribbean now and beyond. And our speaker gave us some insight as to what the world of education can look like for us in the Caribbean, certainly based on these experiences. So once again, I want to thank very much Dr. Kassan Troop, our Acting Chief Education Officer here in Jamaica, for presenting such an exciting presentation. Thank you very much. Having heard from the Acting Chief Education Officer here in Jamaica, we continue on the theme of education. And we saw some wonderful examples a while ago of what's happening and innovative experiences in bridging the gap with COVID-19. But we want to focus now in the next session on learning losses in the pandemic. We want to look at, let's put it this way, despite our best efforts, what's the impact, what's the loss, what's the challenges that we face, and issues of equity across the board. So it's my pleasure to welcome Mr. Sean Powers. Mr. Powers is an economist with the education global practice based at the World Bank Group in Washington, D.C. And it's a pleasure to have him speak to us on learning losses in the pandemic, risks and opportunities for 2020 and beyond. Let's welcome Mr. Sean Powers.
Hello, everyone. Thank you very much for coming to this event and for inviting me to speak on learning losses in the pandemic. My name is Sean Powers. I'm with the World Bank. For the last 4 years, I've been very fortunate to work with the government of Jamaica on various projects in the education sector, including the Ministry of Education, Youth and Information, the Early Childhood Commission, and the University of the West Indies, including an ongoing research project with UE on nonviolent parenting in the context of the COVID pandemic. But for today, I wanted to speak a little bit about learning losses, the phenomenon of learning loss during school closures, the risks that this poses, and also some opportunities for the period of COVID-19 and what comes next for Jamaica and the broader region. I think it's important to acknowledge that even before the COVID pandemic, we were already faced with a very serious challenge in education, which is a global learning crisis. Too many students going to school, but not learning. According to the World Bank's Human Capital Project, there's a gap in many countries between the number of years a student actually completes in school and the amount of learning that they acquire during those years when we benchmark it against countries like Singapore and Finland, which are at the frontier of quality in global terms. In Jamaica, for example, there's a gap of about four and a half years between the number of years that children are attending school and the number of years of learning they would acquire in a top performing system. And that's true across the region. It's over 5 years in Guyana. It's over 3 years in Trinidad and Tobago. And what this means is that even before the challenge of COVID-19, we were off track to meet our global learning goals, including Sustainable Development Goal 4. And at the same time, we were facing extreme inequalities of opportunity between students in different geographies, rural and urban, between higher and lower socioeconomic status. And all of these things are likely to become worse in the context of this pandemic. Now across the region, of course, schools are closed, and this has an immediate and negative impact on learning. For many students, academic learning will largely stop while schools are closed. It's likely that early childhood education will suffer the most, since for children under the age of 8, replicating the school experience is most difficult through distance learning methodologies. It's also likely that families that have higher socioeconomic status, where perhaps parents enjoy a higher level of education, there's greater access to different types of hardware and connectivity to access remote learning, that they'll be able to cope better. And so some of the inequalities between students will actually increase over the course of the pandemic. We're also concerned that attachment to schooling will fall, that fewer students will enroll, more will drop out, less will complete their education. For systems that have a long break, 2 or 3 months during the summer, we already know that learning loss is a real phenomenon. About 25% of what students learn is typically lost during the summer in normal times. And of course, the COVID-19 closures of schools in many countries are going to be much longer than that. We also know that in the region, there are varying levels of access to various types of information and communication technology that might sustain learning during the period of school closures. So for instance, according to a household survey from 2017 in Jamaica, there were over 175,000 school-aged children who lived in a home that does not have an internet connection. And so for that reason, it's very important to take a variety of approaches to maintaining learning, including using different types of information and communication technology, as the CEO was outlining in another presentation. Now, thinking about the short to medium run impacts of COVID, we're likely to see impacts on the household side. First, a likely increase in student dropouts, especially for the families that are most economically vulnerable, the families who are hardest hit by COVID. Given the effects on employment and incomes, we're likely to see decreased expenditures by households on educational supplies and on school fees. And we may also see some families that rely or send their children to private school may choose to switch to public school out of economic necessity. And that will both put a strain on the private education system, but also lead to potentially more crowding in the public education system. We have some global experience from past pandemics, including the Ebola epidemic in West Africa, where adolescent girls in particular were less likely to re-enroll when schools reopened as a result of the Ebola outbreak. In the Caribbean, oftentimes we're actually more worried about boys who tend to have lower learning levels and lower completion rates for education. So that gender dimension is certainly something to watch as schools reopen. We also need to think about the impacts on schools themselves and on the quality of education that schools are able to deliver. There are risks to the quality of education if, as may happen, there's pressure in the coming years on education budgets as governments try to cope with potentially less revenue in the years post-COVID. And it's really important to try to protect these expenditures as much as we can, because what we've seen from past crises is that lower education expenditure transfers through to worse outcomes for students. So for instance, after the global financial crisis in 2008 to 11 in the US, there was an average reduction of about 4% of education spending. And this had a demonstrable effect on students' likelihood of graduating from secondary school. It's also possible that the quality of teaching may suffer. Teachers may not have had access to professional development programs. Teachers themselves are affected in the same ways that all of us are by health concerns, socio-emotional concerns. So supporting teachers is also going to be extremely important. And there may also be just less supply of places in school in general, particularly if private schools are not able to survive the crisis financially. And in the long run, this could, if concerted actions aren't taken, lead to a number of negative effects on education. One is just lower learning outcomes, an increase in learning poverty, which is the share of students who don't have the basic literacy and numeracy skills that they need to function in the labor market and to function in society. A lower stock of human capital. So if students drop out, if students learn less, this translates into lower earnings in adulthood and lower productivity for the economy. Since we know that human capital the skills, the health of the population is a country's true source of wealth in the long run. And so to the extent that that's diminished, that's going to harm long-run growth and development. We also have reason for concern, as I said before, that this could further entrench inequalities of opportunity, especially if there are persistent effects on the children who are from poorer or more marginalized families and communities. There's also the possibility of greater instability if these effects lead to greater crime and violence and an increase in social unrest if there are more unemployed or out of school youth. So I know this sounds a little bit dire, but there is some good news. And the good news is that this crisis is also an opportunity to create a better education system for the future than the one that we've had in the past. And our goal really should be, in effect, not to go back to normal, but to build back better. And there are several ways that policies can improve the pre-COVID status quo by maintaining this greater attention for health and safety of students and staff, making professional development for teachers more targeted and more practical and more practice-based, making sure that curricula are relevant and streamlined, focused on the skills that will prepare students for life, for the labor market, for participation in society, and to accelerate our progress in closing education gaps. I'm just going to touch on a few possibilities given limited time in this presentation, but I would encourage you to visit the World Bank's Education and COVID page for additional resources. There's a short URL on this slide, but also if you just Google World Bank Education COVID, it should be the top result in your search results. So I'm going to share three general categories of responses. First is just to emphasize the importance of helping students prepare to come back to school and bring them back to school. And that may include re-enrollment drives or campaigns. It may include following up with the students who are most at risk of dropping out. It could include providing additional supports for students who are at risk, be that through tuition support, scholarships, and very critically, school feeding programs, which are really important for students' health and nutrition, but also as a support to families that demonstrably helps keep children in school. And also, a lot of research has shown that it's very important to give labor market information and career guidance and counseling to students in higher education and technical and vocational education and training, particularly since they're going to need to navigate a new world after COVID. Looking across the world at all of the research we have on how to improve learning, the principle that seems to be most universally effective is teaching students at the right level. So what that means is very often we make the mistake of saying, here's the curriculum, this is what the curriculum says the students are supposed to know, and then in effect demanding that the students live up to that level of learning. In reality, students come to school with varying levels of learning, varying levels of preparation, and the best systems adapt to the students rather than asking the students to adapt to the system. So after the COVID-19 period, one very important strategy is going to be formative assessment, trying to see where students are, assessing their learning lags, and then recalibrating as needed to ensure that they're able to keep up and build on the skills that they already have and make up for the skills that they may be missing. This is going to require giving guidance and support and additional professional development to teachers to help them prioritize the curriculum and also to support students who are at highest risk. In particular, we also need to support early childhood institutions, since these are where the early literacy, numeracy, social and emotional skills that are so important for school readiness and lifelong learning are formed. And finally, for skills, we need to be thinking about the post-COVID world. And again, thinking in terms of opportunities, this is really a chance to diversify skill sets. Many economies in the Caribbean are very highly dependent on tourism. Even before COVID-19, there was a recognition for a need to diversify, to move into other industries, to high value added industries. And so this can serve to accelerate that opportunity. One area, for example, that the World Bank is supporting several countries, including Jamaica, is increasing digital skills in the population. And this is really a 21st century skill set that can help diversify economies and move out of these traditional drivers, such as tourism, which are highly vulnerable to events like COVID-19. Finally, it's really important not to lose sight of whatever lessons we learned during this COVID period on the types of interventions that work. In effect, we're conducting a giant experiment in distance learning, and I think it's very likely that we're going to find a lot of approaches actually succeed, and they can be part of our toolkit going forward, including in a more business as usual environment. Technology is by no means a silver bullet for education. Simply giving out hardware is by itself not a solution, but technology can be very effective at supporting learning when it follows that principle that I mentioned of teaching at the right level. So things like adaptive learning programs that help students learn at their own pace can be incredibly effective, both in the context of school closures and afterwards. So to the extent that we discover these best practices, we should be sustaining them and replicating them. Another very good evidence-based practice is early warning systems. So in Central America, for instance, we have research showing that we can predict student dropout through certain types of risk factors, including attendance, for example. And so by creating these early warning systems, we can intervene in time to be sure that students get the resources and the type of help they need to stay in school, and also to guide them on the right educational path for them. Teaching at the right level, one way to do this on an ongoing basis when it's safe to do so is to hire young people to be remedial tutors. And this has multiple benefits. It helps the students who receive the tutoring. It helps as a source of employment for young people. It can also be a way to identify promising future teachers and help them fill the pipeline of excellent teachers for the future. And finally, I think one thing we've learned is the importance of support for parents, teachers, and students, including on social emotional factors. This is something where we can take the good things that we've learned in the COVID period and extend them into the future. Thanks very much once again for your attention, and I look forward to your questions and comments afterward. Thank you.
I wish to thank Mr. Powers, Mr. Sean Powers, for an excellent talk focusing on the impact of COVID-19. We're looking at on children and families, but he was able to share with us the concept of learning losses and what COVID-19 is doing to countries and to the educational sector in terms of the gaps and how those gaps impact across the board in terms of the equity across social class and economic income class, and giving us more than food for thought, but some framework and prescription for addressing the learning losses within the COVID-19 pandemic. Thank you very much, Mr. Powers. As we continue our conference on COVID-19 impact on children and families in the Caribbean, now and beyond, it's my pleasure to introduce our next speaker, who will be looking at the experience of adolescents in long-term curfew. She is Dr. Abigail Harrison, who is a lecturer in adolescent medicine in the Department of Child and Adolescent Health at the UWI Mona campus. Dr. Harrison is the immediate past president of the Pediatric Association of Jamaica. And she's a consultant pediatrician, and interestingly, one of 2 adolescent physicians in the Caribbean. It's a very special discipline that Dr. Harrison is involved with. Now, we know it's a challenge for when we have adolescents at home and we give them time out, for a little bit. Even that is a challenge, much less for when the government says, hey guys, stay home for a long time. How do we manage our adolescents in long-term curfew? What are the special considerations for these adolescents? Let's welcome Dr. Abigail Harrison, who will share her knowledge and experience with us.
Thank you, Dean Paul. Good afternoon, everyone. I just wanted to thank the organizers of this conference for inviting me here to speak, and I'm just going to pause briefly to give special acknowledgement to Dr. Carol James Bateman, a colleague who worked along with me. She's from the Department of Sociology, Psychology, and Social Work. That's a really long department name, but it's our sister faculty of the Social Sciences. Okay, so the adolescent in long-term curfew. How many of us have heard these phrases? How long is this going to last? I am tired of seeing my parents when I was at school all day. I would miss them by the time they came home from work, but now they are just always there. So why can't I see my boyfriend again? It's not like he is in quarantine too. It's not that big a deal. I don't mind the quarantine, actually. I get to sleep late, play my video games, but you know, really, I don't have much motivation to do anything else. Home used to be my safe space, but now it has turned into school. What is that? Or school is bad, but online school, oh, that's worse. I really miss my friends. Oh my goodness, I even miss some of my teachers. Do some of these sound familiar? And then, this is about the parents now. They just don't get it. It's not like we're on holiday. We still get lots of work. And there's nowhere to go and nobody to chill with. Sound familiar? Okay, so let's get into the meat of the matter. So COVID-19 reaches everyone globally, and this includes our adolescents. There is disparity in how it affects different countries, particularly those of us who are in the developing world. There's disparity in its clinical presentation, and Professor Christie would have gone through the particular differences with the pediatric age group. And then there's negative socioeconomic impact. And people may think that won't affect the adolescents, but it will. If your parents have less money, you have less money, and they have less money to spend on you, so it's going to affect them. And then there are increased health needs. We've spoken a bit about the physical needs, but I'm going to also speak about the psychological needs. And there will be needs of the adolescents themselves and the needs of the people that are important to them. So let's talk a little bit about what our adolescents are dealing with. Social distancing, physical distancing, whatever you want to call it, it's the same thing. It's distancing. And it leads primarily for them to school closures. So a lot of our educational specialists spoke earlier, but I'm going to give you from the teenage perspective. So just glance at this map. This was in mid-April, and these are school closures, the ones in the bright hot pink. Those are localized closures, but really what that means is that governments recommended closure, but it wasn't mandatory, but for the most part, most schools are closed, if not all. Then this is a little bit more recent. And you'll only see one blue speck in Latin America and the Caribbean, and that's Nicaragua. I don't know what their decision was to maintain schools open, but nobody else in the Caribbean is doing that. We are all closed. Okay, so what happens when schools are closed? We don't get to hang out with our peers, we don't get to see our teachers, and we spoke a bit about remote and distance learning earlier on. But very importantly, there is a loss of a daily routine. And for particular importance, daily routine for adolescents who already have mental health challenges, it's a very critical coping strategy. They know what to expect for their day, and when that is disrupted, it's even more difficult for them to manage. And then we talk about our adolescents who have special ed needs. So those of our young people who may have autism spectrum disorder, any change to their routine can be very discombobulating, and so we have to have special considerations for those. And then when we talk about our young people with attention deficits and hyperactivity disorder, can you imagine being stuck to a Google Classroom or a Zoom classroom and just looking at a screen and all the distractions that are available in your house? There is no amount of medication that's going to allow you to focus quite as much as you need to focus, right? Now there are other things. Missed opportunities, like for major milestones. So many of us may be talking about, oh my goodness, I had major plans for my 50th birthday. It was gonna be big, I was gonna go on a cruise. But guess what? Sweet 16s, big deal for teenagers, huge deal. Graduation ceremonies, they don't get to walk down the aisle. Some of them already bought their dress, or they've been spending ages on Amazon looking for the dress. No more dress. Missed relationships. Now, parents, don't get too stressed, but yes, your children may have some boyfriend or girlfriend relationship going on, and they miss them. And hopefully, if that was, a solid relationship where it was a positive influence that they both had on each other, it's unfortunate that they don't get to continue to interact with each other the same way. And then, of course, there are looming exams. So, some of our younger adolescents, all of them are going, whew, there's no pep. But then they're freaking out like, oh, but I don't really know if I was studying in grade 4 or grade 5, so I don't know what those grades are going to be like. And then, or all the adolescents who have to be juggling with just paper 1 for CAPE and CSEC, right? And then the potential for no summer break, because if the exams are going to be later on down, then who gets to just chill and relax? So the other thing that we have to look at is that, there are some people who have been doing very well in school. And for many of them, this break may be like, no major deal, whatever. But then for some of our academic overachievers, there's a loss of identity. So, they found themselves in their academic achievements, and now that they don't have that to do, they're not getting A's, they're kind of lost. And that may seem very strange to some of us, but it's a very real concern for many of them. And then there are those who are looking forward to champs. I mean, I am disappointed there's no champs, and I wasn't training for it, so can you imagine those who were? And those who have missed out on that opportunity for training and for competition, and sometimes for somebody to scout them out and draw them into universities, right? So many of these may have been paths to independence and a better way of life. And now they're home, and let's be honest, they are really stuck with us as parents and their siblings. Some of their parents have job insecurity or have already lost their jobs. Some parents may be incapable of managing their own stress. And we need to be honest with ourselves that, we're not coping with our own stress, and sometimes we're a little bit more grumbly with our teenagers, and afterwards we're like, I don't even know why I got so miserable with them. Some adolescents may have been, earning a little bit on the side, and now, no more opportunity for that. Some may feel guilty for what their parents are going through, and some really struggle with just feeling helpless. They have no idea how to help in this situation. And then come the physical responses to this new and additional stress. And I say additional because teenagers have stress all the time. Some adults make these very flippant remarks like, what do you have to stress about in life? All your bills are paid, all you have to do is wake up and go to school. But no, adolescence in and of itself is stressful, and it's a very fast-paced adolescent world. So don't compare it to your adolescence. It's a new era. And now with COVID, it's a new era on steroids. So some will have sleep disturbances. They may have difficulty falling asleep. They may wake up frequently in the nighttime, and some may actually even have nightmares. Some will notice a change in appetite, and that can go both ways. They may eat more, and we do quite a lot of emotional eating in Jamaica. You feel bad, you had a bad day, you eat something sweet, something nice. And then some may lose their appetite. So just as they're getting demotivated, they lose their appetite. Some will present with an increase in headaches, especially those who have already had migraine headaches. They'll see an increase in frequency, and I've been seeing quite a bit of that. Some may have chronic fatigue. Everywhere in their body just feels tired, and they feel like they just can't get up and move. And some may have abdominal aches as well, so tummy aches and pains. Now, the fear of the unknown is probably one of the most anxiety-provoking things. And although we do now know quite a bit about COVID, we don't know everything. Because, Prof. Christie just said, there's this new thing, PIMS. Like, who knew about that a month ago? Nobody knew about that. It wasn't here, but it's here now. So, young people are saying, do you really know? People are calling this the new normal. Seriously, we can't live like this all along. And then the truth is, we have to be honest, we do not have all the answers. So what can we do? The best that we can. So it's a major adjustment for all of us, me, you, your adolescent. So let's talk about how we can help the adolescent. First, we want to understand them. So I'm extremely biased. I'm the official optimist and advocate for my adolescents. I think they're brilliant. I think they're creative. I think they're resilient. They're just fabulous. They're fabulous young people, and I want you all to just embrace that phenomenon of fabulosity. But they're also at a developmental stage where they're forming their identity, they're figuring out who they are, and let me tell you, peer relationships are critical in developing this. And even social media, yes, the evil social media is very important. And developing these experiences, being able to, fit 10 people in a space that should only have 3 people, and leaning upon each other and foot on top of one other leg and all of those fabulous things. This is all normal, learning how to trust each other, knowing how to make each other happy, knowing how to make each other laugh, knowing how to say something stupid and be able to correct it. It's critical for adjustment and their social well-being later on in life, and they're missing out on this critical period now. They are also very opinionated. So they're going to come to their own independent impressions of what's happening. And as you probably all know, they have very strong views. But healthy expression of those views is important. So you need to give them space. Gone are the days of being seen and not heard. Old-time business that it don't work anymore. So give them the space and teach them how to have that conversation with you in an appropriate way. And listen. You know, we hear them, but sometimes we're not really listening, so we must listen. This is also the stage where they're striving for their own independence. They want to do it themselves, and they want to do it their way. And the truth is, oftentimes, they're capable of doing it on their own, but they do need our support all of the time. They don't need us to do it for them, but they need our support. So, what do you need to do? You need to start with yourselves as the parents. You need to understand that if you are not coping, then it's going to affect your child. So you need to be honest with yourself and your child, because you are their role model and they're going to learn from you. So if you can display creative problem solving, you know, we as Jamaicans, we are very good at identifying problems, but I want us to work on coming up with solutions. Not just identifying the problem, but coming up with the solution. Invite them in as your adolescent to help you come up with solutions. Help them to see silver linings in this crisis. Say, wow, you know, I know it's a little frustrating me having all of us in the house at the same time, but when last did we have a family breakfast in the middle of the week? That's like so cool. And you make them their favorite breakfast, whatever that is, right? And yes, breakfast will not be at 7. It might be at 11 when they have awakened. But that's okay. Have tea and oatmeal before. And then ask them questions. You know, ask them how they're doing. Don't assume how they're doing. Ask them. And don't give them the answer every time you ask a question. Okay. Help your adolescent to identify what is stressing them and then problem solve around it. And then utilize the family time. So I recommend family dinners all the time, but now you actually have a purpose because you have to get home early. You have to be home in time. And even with the Prime Minister opening up the time a little bit to 9 o'clock, you're still going to get home in enough time to have a family dinner. So you can cook together. You know, you could cut each other's hair. You could do each other's toenails because you can't go for a mani-pedi anymore necessarily. You can go for a walk. You don't have to be a long walk, short walk. You can exercise together, create obstacle course in your house. See who can do more push-ups. See if you can do a plank longer than your son. I mean, it's amazing. You can play dominoes. Lick some domino card on the table together. You can do chores together. So if you have a 10-year-old who may not know how to use the washing machine, show them how to use the washing machine. They don't have to wait until they're later. And then invite them into it as teamwork, and so they have a sense of responsibility. Now, it's important for you as a parent to find that balance. So you can be that helicopter parent who is just everywhere that your child is. That is the most frustrating thing for an adolescent. So you need to give them a little space. But at the same time, you shouldn't be the absentee parent who is never around emotionally. Okay? Now, you may have to consider giving them a little bit of slack with media time right now. Just a little bit of slack. You know, don't be on their case all the time about it because this is the way that they're going to connect with their friends. But at the same time, you have to monitor. Make sure that they're not being exposed to too much negative stuff, right? You want to be focusing on positivity. What is it they say? Unplug negativity and plug in positivity. Try not to take their moodiness or frustration personally. I like to tell my parents when I'm talking to them, it is not about you, it is about your young person. So if they're grumpy today, just, you know, don't take it on. Just say, listen, I realize that this is not working right now. Why don't you take a break, I'll take a break, and then we'll come back together. It's part of the process, right? They're going to get frustrated just like you, but they're not at a developmental stage where they can control it quite as well as you can. There is an innate need for parents to fix their children's problems. Please do not feel that you have to fix it. If your young person is feeling sad and wants to look sad for an hour, let them sit and look sad for an hour. You know, you don't need to make them feel bad for looking sad because then they're going to put on a fake face and you'll have no idea how they're feeling. Adolescents may also try to find ways to escape difficult emotions. And these are the times where we look out for red flags. So have you noticed, a funny little smell on their clothes? Have they been smoking? They may engage in unhealthy sexual activities. They may start to think about ways to end their life. They may get engaged in criminal activities as well. So you have to keep your eye out for changes from their usual behavior. Are they becoming more isolated? Are they becoming withdrawn? And then get family support if you have good family support, or seek out some professional help. Now, a few words to my adolescents. It is difficult times, and we're all going through the same difficult time. So for those who are having some difficulty coping, be reassured you are not alone. There are many people that are struggling, okay? And anxiety is a completely normal response. In fact, it's a protective response. It keeps you safe. However, what you have to do is acknowledge that you're feeling it, sit with it for a while, and then let it pass through. You don't hold on to anxiety. It's an emotion that's supposed to come and pass through. Get information, but not too much. You don't need to be an expert on COVID. We have experts. You don't need to be one. And when you're struggling, you must ask for help. Find a parent, a friend, a good relative. If you have a coach that you're really close to, a teacher, email them, WhatsApp them, whatever, and get help. Create a routine for your day. I know that's going to be hard, and maybe too much time has gone now for it to be easy, but you know what? Do it. Set a pattern of what you want to do. Write a list of all the things that you want to do for the day. And then there is a sense of shared delight when you can cross off what you have completed or tick it off if you have completed it. Exercise or do some physical activity every day. I don't care what you do. It could be dancing. Don't matter. Anything. Utilize some distractions. Watch a movie, but I know Netflix is almost saturated now. You have watched everything, so try something interesting. Read a book. What a novel idea. Make a new TikTok video. Do something new or something different. Learn to cook a new meal, learn to sew. I would tell you learn to knit, but most of you would probably, roll your eyes at me like, get a grip, doc. But it's a thought. And one of the things I think some of you who are home with your grandparents, it's amazing to just sit down with somebody with a lot of experience and just have a conversation with them. Ask them what, life was like when they were teenagers. Have they ever been through anything like COVID? Whatever. Learn to do something new. And I'm going to urge you that when your parents ask you how they can help you, tell them. Tell them what works. Tell them what doesn't work for you. Now, moving forward, we've gotten a little ease up on the curfew. But guess what? All things in moderation. So it don't mean that we have to go kill the extra 3 hours that we get, okay? All things in moderation. Re-entry into school in September, it's going to happen, and it's going to be hard. You're going to have to catch up. You're going to have to adjust to having people around you again. You're going to have to adjust to the new daily routine of actually combing your hair, of actually putting on clothes that are appropriate. It's a new routine. And then there may be some other long-term impact. So in summary, really, we're all experiencing the multiple challenges. And even now, as we open up, there are new and unknown challenges that may come with it. And as adolescents, there will sometimes be a struggle to cope, just as we as adults. But our adolescents are a little less equipped from a developmental perspective, so I want us all to remember that. Having said that, they are resilient, perhaps more resilient than us as adults. And I would say to you, never underestimate the power of an adolescent. So let's support them in the best way that we can. Thank you.
Thank you very much, Dr. Harrison. I think certainly what we're hearing is a ray of hope. I actually heard Dr. Harrison speaking about going back to school in September, and that's very positive indeed. I like the fact that she's an advocate for adolescents. This is a very important group in our families. We're talking today about families and the impact of COVID, and that advocacy that she has shared with us, I hope, is penetrating through all of us as parents, as families, as members of our own family settings, and that we will have a little more patience, understand, and the communication is certainly critical. So I want to thank Dr. Harrison for an excellent talk and for really taking the time to share with us on how we manage this important group within our family setting during this COVID-19 period. Our COVID-19 teleconference is actually being brought within the celebration of Child Month here in Jamaica. And we are happy that as we focus on children, we talk about parents. You heard before Dr. Harrison spoke about adolescents and the role of parents in the managing the adolescents during curfew. We want to focus a little bit on fatherhood, and certainly fathers are an important part as well as mothers of the family. But our next speaker is maybe the first thing I'll introduce him as is a father, Dr. Peter Weller, right? A colleague. He's a psychologist, a community and clinical psychologist. And Dr. Weller is co-chair of the Mental Health and Psychosocial Support Services Subcommittee of the COVID-19 response team of the Caribbean Alliance of National Psychological Associations. So he's a regional man and very well placed to speak to us on, in this conference that has a Caribbean focus in terms of impact on children and families, to speak on fatherhood during COVID-19. We're excited to hear what has changed for fatherhood, what's different, what's going on with fathers during this period. So ladies and gentlemen, my pleasure to welcome Dr. Peter Weller. Dr. Weller.
Thank you very much, Dean Paul. It's a pleasure to be here with colleagues, old and new. And I'm going to be sharing some thoughts on fatherhood. As the title says, fatherhood and the COVID-19 pandemic era. So of course, as we all are aware, this is a pandemic. It's a long-term process. We're in for the long haul. It's not a sprint. And as we talk about fatherhood, we also need to understand that our fathers and their issues. But one of the issues around the pandemic, of course, is that there are youth now, boys, who will become men and fathers during this era. And so we have to kind of take a long view of what we're trying to achieve. So I'm going to be sharing some thoughts. Clearly, this is a big issue, and I can't cover everything. But I want to start by talking about where we're coming from. And I use the phrase, the other pre-existing conditions. So we always hear about hypertension and diabetes and the physical conditions, the medical conditions. But what about the psychosocial conditions that influence our behavior and our thoughts? Because really, we're all programmed by these early experiences. We have the neural pathways, we have the core beliefs, etc., that all operate very often automatically when we make our choices. And this is true for all of us, but we'll be talking about it a bit in terms of men and fathers. But I want to start out by talking about the programs, those are the mindsets that we need to be aware of, because these paradigms, unfortunately, sometimes limit how we approach a problem. And if we're talking about fatherhood in the era of COVID-19, we have to be very careful that we don't begin with what so often happens, which is a kind of problematizing of men and fatherhood, of pathologizing. We need to prioritize this particular group because they are significant. They're significant not only because of their impact, but because as a group they have needs, some of which are unique. And we need to be very careful that we're not fighting against the concept of privileging, which of course is about allocating benefits out of proportion to what is deserved or needed. It's a mindset that we need to change because we need to look at positive profiling, and we need to be very careful that, I use the term psychologizing, we do that appropriately and not, again, in terms of making this a problem. So what are the programs that are running in these men's minds, the minds of dads? Well, to one extent or another, we're all socialized. We're socialized primarily to see men in the context of a power dynamic. We're programmed to be protectors, we're programmed to be pro-risk, we must take chances, we must be out there, not afraid. We're supposed to be providers, financial, in particular, financial providers, that's the expectation. Of course, procreation, the sex is an important part of the identity and the programming of a lot of men, and it starts from our youth. And of course, because we're in charge of running things, we are the problem solvers. So all of these existing mindsets, whether in terms of the us, That is, those of us who are working with men and fathers, those of us who are working for wellness and health promotion, and the mindsets of our target audiences, in this case, men, have to be taken into consideration as we look at what needs to be done over this extended period, this long haul, through the COVID-19 pandemic and beyond. So we want to be very careful that our perspectives and paradigms don't lead us into something that approximates competing victimhoods. You know, we have that pyramid of power as one way of looking at things, and some of our religious and faith-based beliefs do reinforce that kind of hierarchical structure. Now that is existing. Those are people's beliefs. Their beliefs common in our cultures in the region, and particularly having gendered effects. Others have a more, egalitarian perspective. One represents everything interlocked and affecting each other. The thing is that when we have these diverse views and we look at them, some will see a 6 and some will see a 9. And we have to ensure that this does not limit the kinds of interventions that we do. And when I use that image of the 6 and the 9 and these diverse perspectives and paradigms, I bring that also into the context of the family and in the context of the men and women and even the young people and elders in the family who all have different perspectives and paradigms and therefore have different needs. We have to be very aware of that if we're going to try to chart a course forward. So I want to take a minute to look at this picture. Here you see a man on a bicycle, talking on a phone, a child, perhaps his child, asleep on his shoulders, head on his head. And I also want to note that the man is not riding. His foot is actually on the ground and he's supporting the bicycle. But he was probably riding before in the same situation. Why am I showing this? I think that it captures some issues that I want to highlight. One is that the role of fathers has changed. You're seeing more visible interaction. Now, this is not to say that fathers never interacted before, but we're beginning to see more involvement of fathers in sharing the care. We are seeing more involvement of fathers in terms of their public display of affection and involvement. So there are changes taking place, and we could go in. There's a lot of research that has been done across the region and across the world on how men are engaged in child rearing. The image of the deadbeat dad is unfortunately very prevalent, and it's one of the paradigms that we have to be very careful to avoid. So here we have a father who is taking care of his child, but there's a risk involved. And here we get to some of the dynamics that we know are very significant in terms of our socialization. We have COVID coming along, and those COVID issues really highlight some of the challenges that men are going to face. We are powerless and out of control. We feel very uncertain about the future. We can't protect from COVID-19. Money is not around. We're very vulnerable, just like everyone else, and our emotions are overwhelming us sometimes. We're trapped at home with few familiar outlets, and home feels very unproductive because, of course, we are not accustomed to being in that. And I'm generalizing, of course, but many of us are not accustomed to spending so much time in that reproductive environment. We are supposed to be out there producing. So when you bring COVID to us, and as men and as fathers, we have to learn to cope. It's very difficult to accept these limitations. It goes against everything we've taught about being a man. Yes, we're supposed to protect others, but we're not sure how to do it. The facts and information change so rapidly that you're not even sure if what you're doing is the right thing, even doing anything. We don't have access to the resources, particularly the financial resources that are expected of us, and this can lead to conflict and challenges. And we're being told that in coping, we need to name it to tame it. We need to acknowledge our vulnerabilities and our weaknesses. But this is not what we've been programmed to do. We're supposed to be tough. We're supposed to be strong. We're being told we mustn't act out our feelings. But what else are we going to do? The only feelings we know to act out are anger and aggression and frustration. And of course, the problems come with that because that leads to potential conflict and, at the worst case, violence. How else do we ease the tension? Because we can't get out, we can't escape, we're trapped. And therefore, we are at risk of engaging in unhealthy dynamics in the relationships. And those relationships are not just with our partners, perhaps the woman, the mother, the wife, but also in terms of the children, perhaps the elders, and the extended families. For many of us, these extended relatives live with us or live in a common yard. So there are lots of issues, and many of the typical coping strategies that are promoted for men and fathers are not easily accessible because they go counter to everything we've been programmed and socialized to understand about ourselves and to believe about ourselves. So what do? We try our best to cope and address and manage these concerns that are so present around us. So in talking to some of the men in our groups across the region, the consensus was, of course, that economic and financial challenge is critical. And this is not one that is easily addressed because the economies are not likely to right themselves very quickly, especially those that are dependent on tourism, etc. The other concern, of course, is relationships. As I mentioned, the primary relationship is very often with the partner or the spouse. Concerns are also expressed about caregiving issues, and in particular, expectations. Now, because men are very often, and again, we're generalizing, not involved in caregiving, then being in the home, expectations change. Yet skills and competencies, awarenesses and sensitivities are not always aligned with what is expected. And so there are, again, challenges. Working from home, again, also brings concerns that have been discussed in other contexts. Then there are the fathers who are disconnected. They're distant. Now, they may be disconnected because they have no relationship, or their disconnection may be because of the distance. And that's a whole different dynamic because now they're not living in the home, they're isolated, yet they want to connect, they want to be involved. And when they are in the home, there are the issues of homeschooling and all the online dynamics, including access to information, that are challenges, all culminating in disciplinary issues, which too often fathers have been taught that their role is the disciplinarian, which unfortunately includes corporal punishment and physicality. So those are general concerns that fathers are having. Those are some of them, and of course they vary because fathers vary. Now, let us talk a little bit about some of the specific challenges. We have unhealthy coping. We have all the unhealthy coping that is usually a function of abuse of substances. So we have the smoking too much, the drinking too much, even too much caffeine and eating. There is, unfortunately, the online coping that can include gambling, but very often also includes other addictive type behaviors such as pornography. So there's a scope of issues, there are a set of issues that we need to be aware of, and we need to raise awareness of and skills in terms of managing. Some fathers have particular challenges because of the court and the issues to do with child access, custody, etc. And this can be very complicated. There are advocacy groups who are working very hard to try to facilitate more equitable, gender equitable legislation. But at a time like this, there's also a challenge because unfortunately, men are not able to access their children. Sometimes because they are not able to give financial contributions, the court comes into action, and this can seem very unfair, as it is in certain cases. And even more unfair, and the reality is the fact that some partners, some spouses, use the opportunity of the isolation to withhold access to the child, and this can be very stressful to the fathers, particularly because many fathers do not, and many men do not access help. So another issue is about facilitating access to help, psychosocial support, counseling, crisis management. Because unfortunately, most of the behaviors that we will be observing, the ones we are concerned about are the unhealthy ones, but the ones that we hope we can leverage are the healthy ones, are based on core beliefs, and we have to change those. Unfortunately, because of the power dynamics, family violence is an outcome that is increasingly common. And across the region and across the world, those organizations that are involved with services to to alleviate or address domestic violence, gender-based violence, are having an increase in calls because of the family violence. But I can tell you that even at the Coalition Against Domestic Violence in Trinidad, and I'm on the board there, a third of the calls and interventions and folks who access those services are men. So that gender-based violence usually has the face of a woman as a victim. And that is because most of a woman or a child, a girl child, is a victim. But very often men are also not only perpetrators, but victims of domestic violence. So we have to take a holistic view. As I said, it's not about competing victimhoods, but it's about understanding the complexity of this process and the need for collaborative interventions. So just to start very basically and to highlight, we really have to get across to men that it's completely okay and normal in these times. If you're a man, a father in the household, it's okay to feel powerless and insecure and as if you're not in control. This is a natural and normal reaction. To be afraid of the virus and its consequences is also natural and acceptable. To feel crowded and trapped at home, to feel isolated without the contacts and the social, this is all normal. So if you're worried about your health and your family, your financial, professional future, it only means that you're normal and you care. All this is stressful and it limits your ability to take care of yourself. So we have to get across to men that being in touch with how you're feeling, acknowledging your doubts and concerns, and managing your emotions is a part of healthy coping and does not necessarily mean that you're weak or there's something pathological. But unfortunately, when we're stressed, it restricts our views and sometimes makes us unaware and unempathetic with others. So it is important to get across to men that they must be responsible and accountable for how they feel. Now, all of these things are critical because they are the barriers to initiating any of the many self-care protocols that we promote. We have got to ensure that the men are willing to have uptake. We have to deal with what I call a barrier analysis. What gets in the way of the beliefs and knowledge changing into attitude change and changes in practices and behaviors. And this is why it is really important that we begin with understanding the mindsets that we're trying to promote. So that when we teach the stress management strategies, the K is for knowledge, the A is for awareness, the I is for insight, the S is for skills, and the O is the opportunity, which is about practicing and making new habits. We will have people who will be willing to reach out and get the facts and accept the new normals and make wise choices and unpack to repack their emotions, plan what they have to do and feel a sense of control in having a routine, accepting the limitations, and of course, being gentle with themselves. Unfortunately, we as men, and this applies to fathers, are not accustomed to being gentle with ourselves. We are in denial, but that's not being gentle. We avoid, that's not being gentle. Being gentle is knowing and accepting what you're feeling and then managing it and coping with it in a healthy way. So this COVID-19 crisis, it is a crisis, but it is not a short-term crisis, it's a long-term crisis. And former President John F. Kennedy is often quoted as saying that a crisis is a time of danger and opportunity. Ironically, this quotation comes from China, it's a proverb. But in researching it has been found that the actual meaning is that in times of danger, there are opportunities to make new choices. And I think this is critical. We all have an opportunity to make new choices during this COVID crisis. It's not going to be easy. The choices are going to require courage, and some of them may be actually dangerous for some of us. But we have to make these new choices. So let's make the choices so that these boys and youth and the men and the fathers they will become will make the best choices. Let us acknowledge the diversity of dads. They're not all deadbeat. They're not all absent. They're not all caring and giving and empathic. They are diverse. And their attributes are equally diverse. So let us continue to do the research. Let us use the research to inform targeted interventions. And let us be very careful that we understand the barriers that might get into the way of uptake of the behaviors we're promoting. If we're trying to help men and fathers to acknowledge and understand their accountability, then we have to be present with them. There has to be an empathic and informed awareness of what is going on with them, and then they are far more likely to change. This will happen best of all if we can engage all our partners, the faith-based organizations, the CBOs, the NGOs, the state, organizations like Fathers Inc. and Carryman, and across the region you have organizations like Single Fathers Association and the International Men's Day organization. They are not always all on the same page. They are not always all in sync overall, but there are ways in which we can collaborate. And one of the challenges we face is trying to ensure that we don't end up in a competition and a battle that does not have to prevent our progress. We need to involve all influentials. And I mentioned here the Spotlight Initiative, which is a significant intervention that's going to be going on in the Caribbean over the next couple of years to prevent family violence. Many of these initiatives need to be coordinated and collaborated, and those of us who are working on the ground need to be aware of the resources that are available and facilitate the coordination and the collaboration. Because the mental health and psychosocial services during this era of COVID-19 are going to be critical, and they're going to become more complex. So we're shifting the paradigms, and many of us will have seen these images before, showing us how if you see one thing, you may not see the other. But the image to the right is of a woman. Some may see an old woman, some may see a young woman. What is different is that image to my right actually, is of a man. And you're seeing both images alternating in rapid succession. I'd like to highlight that because as we work with men and fathers, we need to understand that if we understand what they are looking at, we are more likely to be able to engage them to look at us and receive our message. It all begins with beginning where people are at. And with dads, it is very much a starting point that we have to emphasize. I want to thank you for your attention and ask you to please keep safe and ensure that others around are safe. In this case, I'm talking about dads and I'm talking about other men. We can be our brother's keepers. Let us have a positive peer pressure effect and prevent these negative consequences of COVID-19. Thank you for including me.
Thank you very much, Dr. Weller. I like the call that you're making to our fathers, to all of us, saying, as fathers, it's okay and normal too, to feel and to some of the experiences we're having and some of the feelings we're having and thoughts. You're saying these are quite normal in this era of COVID-19, given the challenge that we're facing. Be gentle and be kind. And you focus a lot on choices and setting the environment for us to facilitate the making of good choices from our fathers. I'm going to ask just a question, Dr. Weller, and maybe invite you rather, more than a question, to, as we speak of fathers, and within our Caribbean context, there's a lot of organizations geared at enhancing the role of fathers, promoting fatherhood, etc. And I don't want this conference to end without having a clear perspective on the importance of both fathers and mothers. And I know fathers have a particular role, but is there, in the context of what you've just presented for fathers, are there messages in there for mothers, or is the message for mothers different from fathers? Can you comment on that or say something more on that?
I think that it is really important that we promote, that we understand and facilitate and promote co-parenting. This is not to mean that the parents need to be in a relationship with each other, but as long as they're parents, they have a relationship with their child. So yes, there are unique challenges that each gender will face due to socialization and the unequal resources that are available right now, usually with women getting the least of the benefits. But I think that there is critical work that needs to be done, and we need to do more work, I think, starting with the young people, about building the kinds of relationships that will allow them to enter into parenting relationships. And I'm not going to say what kind of relationship they should be in, but I think that is an important starting point. The United Nations and UN Women, etc., have done a lot of work on sharing the care, looking at how to facilitate that kind of partnership and collaboration in the home and with child rearing. And I think that model is a very important one. Even the many NGOs, and as I said, they're not always on the same page, but they're all concerned about children, and they're all concerned about creative skills. What we have to avoid is a focus on the conflict between the father and the mother. Today, I focus on the father and primarily trying to affirm the needs as men and the importance of self-care, but also the implications that if they're taking care of themselves and if they change their mindsets, they're more likely to be good providers, good protectors, good partners. And the partnership, I think, is what we are trying to promote. There's a lot of work that's been done about women and about mothering, and there's probably more of that because socialization says that that is the natural role, the nurturer. But of course, there are many challenges that women face now because they are playing multiple roles by their own choice sometimes because they have no other choice. So their levels of stresses are also unique and different and require particular attention. So it's a big issue and one which we need to, as I said, conduct the research, identify what the needs are, the processes are, and then design interventions that are not only effective but sustainable because COVID-19 is going to be around for a while.
Thanks very much, sir. That's very, very well said. I'm very glad for that addition to the perspective on fatherhood. So really, let me thank Dr. Peter Weller, our community and clinical psychologist, for bringing to light very relevant issues on fatherhood and COVID-19 and giving us a bit of guidance and support during this difficult time. Thank you very much, Dr. Weller.
My pleasure.
Thank you.
Keep up the good work.
Thank you, sir. So we have heard about the learning environment. We've heard about mental health from Prof. Sams Vaughan, the epidemiology, clinical aspects from Professor Christie, looked at the economics and talked about adolescents and fatherhood. And in a conference like this, as we looked at impact on children and families, we have to pay attention to what I call the whole picture. And that whole picture must embrace the question of faith and spiritual well-being. And so our conference wouldn't be complete without having a speaker to look at faith-based organizations and their contribution to the impact, to addressing the impact on our children and family. Now, our speaker is very well placed. In fact, we say this is a conference that's put on by the University of the West Indies here at Mona. And I'm very happy to say that we have called upon, they say, or laid hands on, our Reverend Dr. Stevenson Samuels. Dr. Samuels is our Pentecostal chaplain right here on the Mona campus. He serves us very well. He's a very humble pastor, and he has made an impact on our community, our campus community, our students, our faculty. We're very thankful for his work here, but we're very thankful, especially today, Pastor, for having you here to speak to us on the role of faith-based organizations in COVID-19. Welcome.
Thank you very much. And permit me to commend the University of the West Indies for hosting this teleconference on COVID impact on children and families. It is important for us as a Caribbean society to ensure we are protecting and supporting the sustainability of children and families in their most healthy state, hence the importance of this conference. On behalf of the faith-based organizations, I also say thanks for inclusion at the table. Our long and faithful commitment to the establishment of a wholesome society in good times and also in bad times is an indication that we can contribute to this forum for the establishment of a stronger Caribbean. This presentation specifically addresses the role of faith-based organizations in supporting children and families during COVID-19. A holistic assessment of this topic is better addressed looking at the elements of the physical, the educational or intellectual, the spiritual, the social and psychological needs of both individuals and community. With respect to the physical needs of faith-based organizations, we have been busy at the very basic level offering care packages in low or to low income communities. Some have gone in even more detailed ways in offering kiddies packages to children who are stuck at home and bored. An innovative approach initiated by both faith-based and organizations and the private sector is a collaborative approach where companies provide the financing and items in sizable quantities and faith-based organizations execute the logistics and distribution on the ground in communities. It should also be noted that support is now increased to persons in need of medical support. This is taking place in the form of funding for medication and also treatment in cases such as dialysis and so on. Assistance is also being given to some persons that have lost their jobs as a result of COVID-19. In addition to meeting the physical needs of the society, faith-based organizations are also integrally involved in meeting the educational needs of the society. Many congregations, for instance, are including a COVID-19 update in their main weekly liturgical services. During this segment, they give important health information on the pandemic in addition to new regulations of the respective governments around the Caribbean. Most religious groups have within them health professionals. These members are being engaged as consultants, counselors, and coaches for their respective groups in designing their own policies in combating the pandemic. In addition, they serve on a personal level, engaging individual members, providing information to cope with health-related challenges in this critical time. Another innovative program employed by some organizations is the engagement of their younger and more technologically savvy members in reaching out to their more senior members, providing technical support and training in the use of their smartphones, smart televisions, tablets, and computers to access religious services and other services online. Many of these FBOs are owners of early childhood institutions. They are ensuring that the students under their charge are attended to. This is with a view to ensure the curriculum is complete within the specified time. Spiritual needs are also of concern to FBOs. There is a definite increase in the number of persons seeking spiritual support in this season. Governments around the Caribbean have had to limit public gatherings, which includes the holding of religious services. Many congregations have had to implement new ways of engagement, which is usually centered around some kind of online innovation. As a result, churches are hosting their main worship services online. In addition, they are hosting other kinds of services and gatherings online to include youth fellowship, meetings, teen meetings, children's clubs, prayer meetings, Sunday and Sabbath schools, and members' meetings. Some FBOs are testifying of an increase in the traffic in these gatherings. Strong effort is being employed by clergy to accommodate life ceremonies to include weddings and funerals. These can pose a challenge at times, as some communities are not disciplined enough to contain the number of persons attending these functions in these times. There are churches that are also offering the extra support of online streaming to facilitate families that are abroad and also at home who are unable to attend these services at this time. FBOs are also collectively engaging national leadership for times of prayer, encouragement, and support. It is felt by our religious community that national and political leaders are under significant pressure in this time and will need special attention, spiritual attention that is, and facilitation for the task ahead. It should be noted also that the chaplaincy of the University of the West Indies Mona campus is reaching out in more intense and focused ways to our constituents. This week, for instance, we will be reaching out to the Guild in one of their student fora to provide spiritual and emotional guidance and support. We're also approaching faculties and departments of the university to offer prayers, counsel, and encouragement to faculty, administration, and students. Also, chaplains are reaching out to some students who did not get the opportunity to return home. Care packages and funding are being offered in some instances. Socially, the FBOs are creatively establishing virtual care groups or small groups where each member is being cared for by a leader. This is to ensure that there is equity in serving the wider population. Leadership of FBOs are also encouraged by their national bodies to facilitate members of their entity and the wider community to access government assistance programs. As a result, congregations are on the ground helping persons to fill out forms and giving advice on how resources can be accessed at this time. FBOs are assisting physically, educationally, spiritually, and socially, but they are also engaged in supporting persons and communities emotionally. Educative counseling through webinars are being hosted by a number of groups at this time to address several topics, the way in which we are doing it now, related to COVID-19. Grief counseling is also being offered to families that have lost loved ones in this season. In some instances, those who have died are in other countries, and family members are unable to attend services due to border closures. FBOs regret the impact of COVID-19 upon the populations of the world, and in particular in the Caribbean. We offer condolence to those who are in mourning over the death of loved ones. We remain committed, however, to serving humanity and are determined to do all we can to increase our service to children and families in this time. God bless you.
Thank you very much, Reverend Dr. Stevenson Samuels. Certainly a very clear description of the role of the faith-based organizations at this time. What we're hearing is that the role of the church is, and the FBOs, is very much alive and well in the broadest sense, as you may say as it has always been. But COVID-19 has impacted the way in which we worship. It has impacted the lives and the well-being of our citizens. And what I'm hearing is that the faith-based organizations have responded well to the call in terms of counseling, support, getting out in the field, and supporting families, which is what we're really talking about today, families and children in the Caribbean. So we have, later on in the program, you will hear, as we bring later on at the close, we'll talk about hope for parents. And this is already we're seeing through the work that is being done day to day by faith-based organizations. There is hope very much alive out there. So thank you very much, sir, for presenting and taking the time to come and share with us today. Thank you. As we continue on our conference, our COVID-19 conference, Impact on Children and Families in the Caribbean, we're now going to move to a topic that I would say is interesting and perhaps makes us think as we look at the question of the pandemic and its impact on our population. We're going to talk a little bit about violence against children in emergencies and pandemics. And it's my pleasure to introduce our speaker for this topic, Ms. Itzke Van Winden. Ms. Van Winden is a child protection specialist and consultant with UNICEF. She's worked for many years now, over a decade, with UNICEF all over the world, in Africa, in the Middle East, and so on. And she has been with us now in the Caribbean for just about a year and a half. And here we are, pandemics, COVID-19, and she's had the opportunity to work with our government and with our NGOs, with our university, in terms of looking at the protection of our children and women. And so this morning, we are very happy to have Ms. Van Winden speak to us on the topic, violence against children in emergencies and pandemics. What do we know, and how can we prevent this? Let's welcome Ms. Van Winden.
Thank you. Thank you so much for the lovely introduction. Thank you very much to the organizers of these events. Thank you to the Dean and also to Professor Samswam for giving me the opportunity to speak here today. I work with UNICEF, indeed, the United Nations Children's Fund, and UNICEF is that arm of the United Nations mandated to protect the best interests of children and promote the Convention on the Rights of the Child. We function in 180 countries across the globe, and we have been partnering with Jamaica since the 1960s. So I'm here today because I work with UNICEF on preventing and responding to violence against children. But I'm also here today as a parent of 2 children. I have a 5-year-old boy and a girl who's 8 years old, and I have a picture of my 2 kids here, up here on the board. We are a Dutch family, and indeed we only moved to Jamaica a year and a half ago. But I guess, as you can see from the picture, my kids have fully embraced their new country, Jamaica. The reason I wanted to start my presentation by sharing this photo of my own children with you is that parents and caregivers are playing quite a unique role in this COVID-19 pandemic, because the unique nature of the pandemic places parents as the first-line responders for children's survival, learning, and protection. Therefore, efforts to reach children, particularly the young ones, need to begin by reaching parents with support, with encouragement, and practical, actionable ideas to support their children in this time of crisis. Even in the lowest resource settings in extreme deprivation, there are action parents can take to promote their children's development and protect them from violence. And I will touch on this later on in my presentation. Now let me move to the next slide. So first of all, what do we know about violence against children in emergencies? We know that there are threats to the safety and well-being of children in every emergency, be it an earthquake, a hurricane, a civil unrest, conflict. Children may be displaced, there may be a breakdown of family and social structures and lack of access to basic social services, all of which may lead to serious child protection failures. Some of these risks definitely apply to COVID-19, but there are also differences, in the sense that COVID has created a perfect storm of factors that will almost certainly lead to an increase of unreported cases of child abuse and neglect, as children are cut off from interactions with professionals and teachers, as they are confined at home with caregivers and relatives, and families are feeling the stress and anxiety of job loss and economic uncertainty. The nation's system of detecting abuse and neglect, which is heavily dependent on reports by teachers, by doctors, by other professionals, is weakened in this new situation, as in-person and face-to-face interactions between children and professionals are being minimized by social distancing measures. And to illustrate this point, and I've put it up here on the slide, preliminary reports of child abuse to the National Children's Registry in March 2020 fell by approximately 28% compared to the previous month. In response to this growing concern, we are therefore calling on the general public to be extra diligent during this time and report suspected child maltreatment to the National Children's Registry hotline if it comes to their attention. So what else do we know? Let's take a closer look at the socio-ecological impact of COVID-19. We know that movement restrictions, loss of income, isolation, overcrowding, and high levels of stress and anxiety are increasing the likelihood that children experience and observe physical, psychological, and sexual abuse at home, and particularly those children already living in violent or dysfunctional family situations. And this is why the risk of violence is so acute in the Jamaican context, because research indicates that the majority of children is already exposed to violence on a regular basis, particularly violence that takes place within home and family settings. What are the potential child protection risks? I just wanted to run you through some of the key risks. First of all, physical and emotional maltreatment on top of that slide up there. This is due to, for example, the psychosocial distress of parents and caregivers and increased obstacles to reporting incidents. There's gender-based violence, or GBV as it's often referred to, that's due to isolation measures, lack of access to GBV services, and persistent gender inequalities. We also have considerable evidence demonstrating that domestic, interpersonal partner violence and child maltreatment are linked, meaning that if the household experiences one type of family violence, the household is in an increased risk of the other as well. We have mental health problems and psychosocial distress due to, for example, isolation measures and economic uncertainty. Child labor due to school closures, loss of family income, separation from family due to illness of family members, and social exclusion due to disproportionate impact on more disadvantaged and marginalized groups. Now, I realize that I have not painted I've painted quite a bleak picture up till now, right? But there's also hope, there's also good news. There are very concrete actions that can be undertaken to prevent and respond to violence. And in the long run, it is possible that this crisis could act as a catalyst that causes us to reevaluate child protection at its core, not just here in Jamaica, but in other parts of the world as well. Now, if you're interested in learning more about child protection in humanitarian settings, we have the minimum standards for child protection to guide our work in humanitarian action. And specifically for COVID, we also have a number of technical guidance tools that have been developed by numerous organizations across the globe. Time doesn't really permit me to go through them in detail. But if you're interested, I would definitely encourage you to go online and consult these. It's very interesting material. I also have for you a few concrete examples of UNICEF's COVID-19 child protection response in Jamaica to just give you an idea of what we've been doing as an organization. So at UNICEF, we are working across sectors. So across sectors of health, education, social welfare, justice, to support government efforts to reach children and their families and to ensure that child protection is a priority within the response. We have shifted our response from face-to-face interactions to now virtual media and telephone-based interventions. And if you visit our website, you will see the broad range of interventions that we've been supporting across the islands. For example, we have engaged, you can see that on our website, we have engaged in risk communication and community engagement through the production of videos and content development for social media, TV and radio about the prevention of violence within the context of COVID. We've also supported the establishment of parenting support helplines. Because, as I mentioned at the beginning of my presentation, the unique nature of the pandemic places parents as the first-line responders for children's survival, learning, and protection. And this is why it is so crucial to support parents in the performance of their child-rearing responsibilities. The parenting helplines have been established through a public-private partnership between the National Parenting Support Commission, our implementing NGO partner Fight for Peace, of course UNICEF, and private sector entity Victoria Mutual Foundation, VM Foundation. The helplines are manned by parent mentors who are trained to provide tailored parenting advice and psychosocial support to parents and caregivers, and to make referrals to relevant social services. In addition, UNICEF is also partnering with the Women's Center of Jamaica Foundation to provide the necessary virtual, academic, psychosocial, and parenting support to adolescent mothers, a particularly vulnerable group. So these are just a few examples of UNICEF-supported interventions. And going forward, we have more lined up. We will, for example, be improving data collection mechanisms to assess the real prevalence of violence, promote reporting, and educate the public about the harmful effects of violence. Now, you may be wondering, what could I practically do to support efforts to prevent violence against children? Here are 3 key strategies. To start, be extra alert to signs of child abuse. And if you know or suspect that a child is being abused, neglected, or otherwise in need of care and protection, make a report to the National Children's Registry. If you are a parent or caregiver, practice healthy parenting to get through the crisis and encourage those around you to do the same. Remember that all children misbehave. It's part of childhood. It's normal. When children are tired, hungry, they may be afraid, or they're learning their independence, right? They can drive us crazy, and especially when we're stuck inside, right, at home. So this is a stressful time. Take care of yourself, and so that you can support your children and teach them that violence is not the answer. Beating is not the answer. Please do reach out also to the parenting support helplines that I just mentioned. There are helplines in each and every parish, and they provide, as I said before, they provide practical parenting tips and advice, and the list of helpline numbers is also available on the UNICEF website. And finally, children and teenagers are now spending a lot more time online, and they're completing schoolwork, they're taking classes, they're connecting with their friends, they're playing games online. And so that also brings along some risks. They're at higher risk of sexual grooming, sexual exploitation, cyberbullying, and other online threats, especially when you couple this with an increased number of adults working from home and under prolonged isolation. So to tackle these challenges, support and guide children with open communication, discuss these risks with them, to avoid online risk and have safer experiences. So, where to report child abuse? What I put here are the phone numbers of the National Children's Registry, as well as their email addresses, and where to get help for domestic violence. Here are the numbers, 2 key numbers to help if help is needed for domestic violence, if assistance is needed. This brings me also to the end of my presentation. I thank you very much for your time, and thank you again for having me here today. Thank you. Thanks.
Thank you very much, Ms. Van Winden. I think what we're hearing fits in very nicely too with, we had an earlier presentation by Dr. Harrison on the managing adolescents, and reinforcing some of the messages that we heard. And I'm struck by how Ms. Van Winden put it across to us, that COVID-19 has brought a perfect storm. I mean, a perfect storm in terms of the risk of children facing abuse and violence in the homes. And you really have made that point about the social distancing, the limited face-to-face that we now have doesn't allow us to pick up some of the signs that we'd usually pick up, parents and teachers and so on. And that has really struck me, that this is something we have to grapple with. Also, I think that the points, one take-home point for me is the importance of supporting parents. again, as a key part of the family. We're talking about COVID and the families and the need for parenting organizations to be supported, and UNICEF is doing that and other organizations, in terms of the alertness to our children. So, ladies and gentlemen, you've heard good advice, good recommendations. The shout out to the agencies that exist across the region. You've heard the numbers for Jamaica, but I'm sure throughout the region you have similar agencies in the countries to which we can make reports, but also agencies that can support parents. And we within our families itself, remember this is about families at the core of it, we have to also be on the alert and do provide the support for our children, our adolescents at this time. Thanks very much again, Ms. Van Winden, and thanks to UNICEF also for supporting us this conference. Thank you very much. Ladies and gentlemen, we have had a wonderful morning so far, and afternoon. We have heard about the COVID-19 experience in the context of the impact on learning and school. We have looked at some of the economic issues tied to the education system. We have heard from how do we take care of adolescents who are on an extended period of curfew, during the extended curfew. We talked about fatherhood, looked at the role of the church, and violence in children. That's a lot, isn't it? That's a mouthful. And really at the end, we want to bring, again, we continue to always, throughout of this experience, we bring hope and a sense of support for all of us who are in this together. And should I say, backed by popular demand? We had the opening batsman, Professor Celia Christie, earlier. Now we have I wouldn't say it's a tail ender in terms of batting nor bowling, but somebody who's quite capable and competent in the form of Professor Wendell Abel. He's back with us for the third successive appearance in our conference series. Professor Wendell Abel is Professor of Mental Health in the department. He's currently the head of the Department of Community Health and Psychiatry here at our University of the West Indies, Mona. And he has a distinguished track record in terms of public service, caring for the disadvantaged. He's a human rights advocate. And this afternoon, he's going to advocate for helping parents to cope with work, childcare, teaching, etc., during COVID-19. How are parents coping and how can we help them to cope? Ladies and gentlemen, help me in welcoming Professor Wendell Abel to the podium.
Thank you very much, Dean Paul. Good afternoon, everyone. Now, when Professor Christie first invited me to speak, I did not know that there would have been a third round. But here we are again, and today I'm pleased to have a conversation with us on work, childcare, teaching, helping parents cope. I take us back to March 10, when the first COVID case was reported in Jamaica. That was the breaking news. And today, we're now having discussions about the new normal. And the question is, what is that going to be? I think it's a question that we will struggle through in the days ahead as we adjust to this new normal. But I want to pause because this is a conversation I hope to have with us, albeit virtual. And the first question I want to ask is, how are parents coping? And I have some voices I want to share with us. One mother reported, "I'm overwhelmed. I feel like a teacher, janitor, chef, cook, servant, and sometimes prisoner." Another reported, the arguments and fights, as families are locked in their homes and tension mounts sometimes. And another, "My children are driving me crazy. I can't cope." And yet another, "She has started to drink again, problematic drinking and drug use." And the list goes on. And we'll see life has changed for many of us, with home, with family every day, school closure, struggling with the financial issues, the chaos sometimes in the home, the caregiving demands, and a lot of parents will tell you that they not only have their children to take care of, but they have their parents and sometimes grandparents. And this sometimes can be very demanding. And so overall, it's a lot of stress that people are dealing with. And as we adjust to this new normal, you know what's a great challenge? There's no rule book. Nobody really prepared us for this pandemic, a pandemic of this proportion. No rule book. And so we all have to start from scratch, calling on our inner reserves at times. And so what I want to share with us are some tips this afternoon. And the first point I want to make is that our number one agenda must be to prevent burnout. Because as we listen to the voices, we realize a lot of parents are under stress and strain as they deal with the multiple roles they have to be playing, the multiple demands, and the multiple sources of stress. And, you know, as we begin to adjust to this new normal, we have to look out for a lot of adjustment-related disorders, such as anxiety disorder, depression, post-traumatic stress disorder. Depression is a big one because it's about one of the most common mental disorders that we have to deal with. Under normal circumstances, over a lifetime, 20% of women will suffer from depression and about 10% men. And so it's important that we pause and to screen for depression. And so where you're sitting today, I want us to fill out. This is a screening tool. And I want us to go through it step by step and to fill the column. And so I'm going to give us some time. If over the last 2 weeks, how often have you been bothered by any of the following? Little interest or pleasure in doing things, and it's not at all several days, more than half the days, nearly every day. Feeling down or depressed or hopeless, trouble falling or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about self, or that you're a failure, or you have let yourself or your family down as you try to cope with all the demands. Trouble concentrating on things such as reading the newspaper, watching the television, for some persons even reading their Bible. Moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. Thoughts that you'd be better off dead, or of hurting yourself. All right, so I'll give us some time to complete. And what I'm going to ask us to do is to add our scores. If you don't complete it, then just now, you have time to do it later on. You can actually download this questionnaire. It's called a patient health questionnaire on the internet. You can download it, make a score, and based on the score, you can contact us here at the university and we will tell you what to do. But in terms of the score, if your score is about 5, it means that you have mild depression. 10, moderate depression. 15, you're moderately severe depression. And 20, that's a high score, severe depression. And if your score falls in any of these, you really should contact your family practitioner or psychiatrist or whoever you feel comfortable with and discuss what options you may want in terms of dealing with it. The second tip I want to share with us is the need for us to positively affirm ourselves, positive affirmation. And this is something I learned spending time in the country sometimes with my grandmother, that at the end of every day, a long day, hard work, she would lift her head heavenwards and she would say, when men on earth have done their best, angels in heaven can do no better. Right? And so I want us, I know parents, you're having great challenges sometimes. You're doing your very best. And sometimes the best is not good enough. But I want you to just repeat with me wherever you are now. And close your eyes if you want and just repeat. Repeat to yourself. These are difficult times. I can't be perfect at everything. I'm doing my best. And affirm that in your conscience and accept it. That you may not be doing your very best. It's hard to do your very best under these circumstances. But I think for most persons, you're doing your best, your very best. Tip number 3, with the many roles you have to carry out. Homemaker, maintaining the home, taking care of the children, sometimes intervening in fights, getting them to do their work online, and this can be a challenge for many persons. It's so important to maintain structure, right? And so it's important for parents to ensure that they establish routines for themselves. Get up in the morning, have a shower. If you're working around the dining table, make sure you set it up as if you're going to work. Get some structure. It's important. So it's important to set the structure for yourself, but also sit with your children and have them develop structure, timetable, like what they're going to do throughout the day, what time they're going to have break for play. But it's important for us to maintain structure in these times. Number 4, this is a big one, self-care. And in terms of self-care, it's the big 3 that we always talk about. Sleep. It's very important that we ensure that we get adequate sleep at the right time, whatever works for you. It's also important that we maintain a certain level of activity, especially during the lockdown and so it's difficult for us to go out and so. But, we have to put greater effort to just maintain a reasonable level of physical activity. We know that exercise is probably one of the most, it's one of the greatest investment that we can make in terms of our health. So we have to maintain a good level of activity. And of course, we all have to pay attention to our diet. And I'm struggling with that, right? So I'm guilty. But they're the big 3, right? And if you don't take care of them, sleep, S, activity, A, D, diet, you will become sad, right? So make sure you pay attention to these. And while we maintain structure and we ensure that we're taking care of ourselves, I think the buzzword is balance, 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 and more. Just try to maintain some balance and harmony in your life at this point in time. Number 5. How does one really stay calm in the chaos sometimes in the home environment? And it's important that we remain calm. It means that sometimes you have to find quality time for yourself, just to be away from the family, or sometimes time with your children, right? In whatever space that is accessible to you, that is realistic to you, because we're all living in different contexts under different situations, and we just have to carve out a little space sometimes. And in that space, to retreat to a place called calm and maintain some calm in the chaos. For those of you who have seen previous presentations, I have to mention this, which is the importance of managing our emotions. And if you go back to previous presentation, I won't elaborate here. We emphasize that you have to name your emotions and tame it, yes? And I'm just going to focus on another technique that parents will find very useful in terms of just managing their emotions in the home environment. And it's important as parents that we all manage these emotions because children model the behavior of the adults around. And so this technique is called the iMessage technique. And let's say you're feeling overwhelmed. You can say to your partner, friend, family member, to the children that, look, I feel overwhelmed because today I can't cope with the working, teaching, everything. You can scream it out if you want. And what I want is some help, please, or just some time out. But it's a simple technique. The what we often do is speak using what we call you message. So you'll shout at the children and say, oh, you're driving me crazy. You children are no good. You're worthless. Yes? We use a you message, which is really not the best way to communicate. And especially during these times, use the I message. It works if you work it. And number 6, tip number 6, support matters. It does matter. Right? And so I'm going to encourage us to continue to keep in touch with our family, friends, parents, other parents through PTAs. Some schools are having virtual PTA meetings, right? Teachers. Every time I speak to teachers, they tell me that they're under great pressure because the children and the parents call them continuously throughout the day. But thank God, many of our teachers are still accessible. So keep in touch with them, right? And also keep in touch with the resources that are online. There's a wealth of material now online for parents. I find one particularly useful, which is Teachers Pay Teachers. And they have a lot of material that parents can use to teach their children and to just engage children on a daily basis. And UNICEF also has a lot of material online. And all one has to do is just go online and type in resources for parents, and you'll see a lot of material. So, you can choose what you like. And as I come to an end, I just want to share with you a message from a little boy. And this little boy, I imagine this little boy months in the future saying, if I were born with all my knowledge at birth, I would have said to my parents something like this: push, but do not shove. Talk, but do not scream. Teach, but do not lecture. Hold me, but do not pull me. Guide, but do not take my place. Lastly, love me without measure, especially during the COVID pandemic. And my last tip to us all is survive, please. And this is a personal plea from someone who lost his mother at age 6. I'm saying to all parents, when you have this personal experience, I need you to survive. And so to all the parents, you are important to us. We need you to survive. Thank you.
What do I say after that? We're talking about hope for parents, and I want to use that iMessage technique, Professor Abel, and just to say I feel that hit the spot. It really hit the spot. Amidst the seemingly stress and strain, today we are talking about impact of COVID-19 on families, and we made the point that the vulnerability issue goes really way beyond our senior citizens and our persons with, existing conditions, pre-existing conditions. It goes really at the heart and soul of families and our children, our young people, our parents, and that unit that is really the heart and soul of our community and our social life. And you've left us with really a very powerful but calming message this morning that there is hope. There is hope. There's hope for parents, and I think your message is so pervasive this morning that I feel confident in saying you've left us with a sense that there's hope for all of us. Thank you very much, Prof. Really, really appreciate your return, coming back to share with us and leaving us with really good news and positive affirmations. Thank you so much. So, ladies and gentlemen, we've had a good time together. We've had a full morning, and now we are into afternoon. But as we wind down and close this conference, it's my pleasure to say thanks. But before I say thanks, I just want to have just a quick reflection. We heard today the concerns about COVID-19 within families, as it affects children, parenting, school. We heard about the role of the faith-based organizations. And I think what we can distill out of that too is we're seeing a coalition of partners working together across, from the family sector, if we think of the family as a unit and as a sector, to the NGOs, the supporting organizations that support parenting, the church, faith-based organizations. And within all of that, the specific role and the specific challenges faced by fathers, mothers, adolescents, children, the challenges of schooling. Also, what we heard this morning is that there's hope. I think this conference today drew a lot on practice, innovation, and solutions to address the challenge that we face. And we are leaving here today, this afternoon, with a sense that as we move into a phase of the pandemic, where if you hear the discourse now more and more, you hear the discourse talking about reopening, reopening economies, about getting back out there with the cautions and the mask and so on. But there is a sense that we are, as much as we grapple with what we have been faced with, the challenge of the emergent pandemic and its impact on the clinical and the health of our population, that we are moving into a phase where the impact is being looked at in a broader sense. And this conference was today directed in that area where we looked at education, mental health. We argue that the world may not be the same again post-COVID. And so some of what we are left with in terms of moving forward are the issues of what has been the change, what has been the reshuffling of the deck in terms of our families, society, children, the way we teach, the way we learn. Is it different going forward? And I think there was enough food for thought on the table today about these issues. Overall, I want to say we heard a diverse, holistic, and informative, and yet all the while a positive approach to addressing the emerging post-COVID era, and even the challenges that we still grapple with today. We left you, our very last speaker left us with a wonderful ray of hope as we go forward. Hope for parents, hope for families, hope for children. So we trust that you've enjoyed the time with us, the conference. We thank you for your questions. As we close, I want to thank all the speakers. Excellent group of speakers. I'm sure you'd agree with me, those of you out there who tuned in, that we had very competent, very able, and very stimulating presentations from all our speakers. So thank you very much, all those who took the time to share. I want to thank again Professor Sams Vaughan for her initiative in guiding this conference, guiding the program, and giving the support to make this happen. Thank her very much for her contribution. I also want to thank our Mona Media team of the Mona Information Technology Services. An awesome team, first class, really always delivering high quality work. We thank them for teaming up with us here today in delivering this conference. Also, our Marketing and Communication Office of the University of the West Indies here at Mona, our FMS team, our Faculty of Medical Sciences team, Mr. Damian Brown, Ms. Sharon Roberts, Melissa Walker, all who played a role, and working also behind the scenes and in front of the scenes, Professor Celia Christie, who has continued to give us strong support, moral support throughout this. Last but not least, thank you. Thank you for tuning in, for joining in. Thank you for your many questions. We may not have been able to answer all of them right away, but we take note and we'll do our best to keep the communication going as we move forward. We are happy to have brought this conference on behalf of our University of the West Indies here at Mona, and we continue to play what we see as a very important role in our Caribbean region in terms of sharing new knowledge and bringing hope and support for Caribbean people. Thank you very much for joining us.